Tes, tes. Before we starting the event, we will present you a welcome dance from the extracurricular dance from Health Polytechnic of East Kalimantan.
Good morning, ladies and gentlemen. I would like to introduce ourselves. My name is Suryanata Kesuma.
And I, Rosalyn Arifah Putri, and it is wonderful and precious for me to be your master ceremony in this virtual conference on Thursday, 24 November 2022 in Health Polytechnic of East Kalimantan.
In this beautiful moment, I would like to welcome to all the participants in virtual conference by Zoom meeting and live streaming on our YouTube channel.
And we would like to greet our incredible speaker. It is truly an honor to have you here.
The Honorable Director General of Health Workers Ministry of Health Republic of Indonesia, Arianti Anaya, Dentist, Master of Public Health.
The Honorable Director of Health Polytechnic of East Kalimantan, Mr. Dr. Management Haji Supriyadi, Bachelor of Nursing and Master of Nursing.
The Honorable, all the keynote speakers in this conference. The first, Professor Dr. Muhammad Nazil bin Saleh, Deputy Chancellor Academic and Internationalization, University College MAIWP International, Malaysia.
Dr. Bhumika Talwar, Research Officer at State Institute of Health and Family Welfare from India.
Arjon C. Gomez, MANRN, Centro Escolar University Manila from Philippines.
Dr. Norbay Zura MD Yusuf, Faculty of Medicine and Health Science from Malaysia.
Dr. Dwi Prihatin Era, Master of Nursing, Surgical Medical Specialist from Health Polytechnic of East Kalimantan, Indonesia.
The Honorable Vice Director of Health Polytechnic of East Kalimantan with all staff.
The Honorable Head of Education Center, Head of Division and Subdivision from Health Polytechnic of East Kalimantan.
The Honorable Head of Department and Study Program of Health Polytechnic of East Kalimantan.
The Honorable Lecturers and Educational Personnel, as well as all the conference participants that we are proud of.
Assalamualaikum warahmatullahi wabarakatuh. All praise and gratitude belongs to Allah Subhanahu wa Ta'ala because He gives happiness and health to attend this event. Furthermore, salawat and salam may always be given to our Prophet Muhammad Sallallahu Alaihi Wasallam, who has guided us to a blessed path. Please welcome. The second is Borneo Health International Conference.
With the theme is role of research and innovation by health workers through health transformation, embracing smart society 5.0.
All participants can see this conference via Zoom meeting and YouTube streaming. This conference is organized by Health Polytechnic of East Kalimantan with more than 500 registered participants and supported by one of our sponsorship from Bank Tabungan Negara.
Ladies and gentlemen, let's begin our conference by reciting Basmalah. Bismillahirrahmanirrahim.
Singing Indonesian National Anthem Indonesia Raya. To all audience, please be stand up. To audience, please be seated.
In order to have our seminar run conducively, let's us invite Mr. Armawi Eka Putra, Bachelor of Literature, to lead us in prayer. To Mr. Armawi, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Dear honorable seminar participants, please allow me to lead Islamic prayer and the Muslim participant conform according to respective belief. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Hamdan syakirin, hamdan na'imin, hamdan yuafi ni'amahu yukafi'u mazidah. Ya Rabbana lakal hamdu wa lakal syukru kama yanbaghi li jalali wa azimi sultanik. Allahumma salli ala Sayyidina Muhammad wa ala alihi wa ashabihi ajmain. Ya Allah, today we gather to stay in touch in the context of international seminar. Please make this activity and charity of worship for us. Make us always learning continuously. Please make people who always take care of the knowledge that you give. Hopefully our knowledge is useful for us and other people. For the advance of our institution and our society, Ya Allah, please protect us from the harm of this work and the hereafter. Ya Allah, forgive the sins of our servants. Let us be humble people, grateful servants and learners who always have patience in living life and living. Ya Allah, forgive the people who are always diligent and repenting and keeping our souls. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
Report even from the chairman of the committee to Mr. Dr. Nurse Ratanto, Bachelor of Nursing, Master of Nursing, time is yours.
Siapkan dulu itunya. Assalamualaikum warahmatullahi wabarakatuh. Good morning everyone. Excellence, the General Director of Health Worker, Ministry of Health, Republik of Indonesia, Ibu Dr. Gigi Arianti Anaya, Magister Kesehatan Masyarakat. The respectable Director of Politeknik Kesehatan, Kementerian Kesehatan Kalimantan Timur, Bapak Haji Supriyadi, Magister Keperawatan, and the Vice Directors. The Honorable invited speaker and all participants of the East Borneo Health International Conference 2022. Ladies and gentlemen, as chairman of the second East Borneo Health International Conference, it gives me great pleasure and honor to extend to you all a very warm welcome on behalf of the International Conference Committee. I wish to take this opportunity to welcome the participants from Indonesia, Malaysia, Philippines, and India as the representative of the student, lecturers, and researchers who join us. Poltekkes Kemenkes Kalimantan Timur was held the international conference in 2021, and this year, Poltekkes Kemenkes Kaltim is going to have another second international conference known as East Borneo Health International Conference 2022. The theme, Rules of Research and Innovation by Health Workers through Health Transformation, Embracing Smart Society 5.0. In this conference, the scope of activities are nursing, midwifery, laboratory and medical technology, food and nutrition, and health promotion. This event held in one day from 9 a.m. to 4 p.m., November 24th, 2022. EBIC 2022 contained 5 plenary lectures, 1 keynote speaker, and 5 panel sessions with 32 speakers, and 16 poster contribution. For the selected article will be published in Proceeding, indexed by Google Scholar, Neliti, Copernicus, WorldCat, Crossref, and Sinta Index Journal. The Honorable Ibu General Director, Ministry of Health, Ibu Ariani Anaya, it will be an honor that you deliver a speech and officially open the East Borneo Health International Conference 2022. Last but not least, I strongly hope that all of the distinguished guests gathered here today will offer your generous support and encouragement for the success of this event. Once again, I am most gratefully for your participation and support. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
We would like to invite our Director of Health Polytechnic of East Kalimantan, Mr. Dr. Haji Supriyadi, Bachelor of Nursing, Master of Nursing, to give a welcome speech. To the Honorable Mr. Supriyadi, time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon everyone. Bismillah, alhamdulillah, wassalatu wassalamu ala rasulillah wa ala alihi wa sahbihi wa mawalah. The Honorable Director General of Health Worker, Ministry of Health, Republik of Indonesia, Ibu Dr. Gigi Arianti Anaya MKM. The Honorable Deputy Directors of Health Polytechnic East Kalimantan, the Honorable all the speakers, the Honorable the Head of Study Program in Health Polytechnic East Kalimantan, the Honorable the Head of Division in Health Polytechnic East Kalimantan, the Honorable all staff in Health Polytechnic East Kalimantan, the Honorable the Head of Professional Association Organization, and all participants of international seminar who have participated in this international seminar through Zoom rooms. At the first, let us thank to God Allah Subhanahu wa Ta'ala who give us the healthy so we can gather in this place. Moreover, let us praise, salawat and salam to the Prophet Muhammad sallallahu alaihi wasallam. Ladies and gentlemen, today is 24th November 2022 and the COVID pandemic has still not ended yet. However, we must happy and grateful because we have gathered here to carry out this international seminar with the theme Role of Research and Innovation by Health Workers through Health Transformation Embracing Smart Society 5.0. This seminar is also a program from the Division of Research and Community Dedication in Health Polytechnic of East Kalimantan. Ladies and gentlemen, Indonesia is an archipelago country which has impacted on the difficulty of reaching access to health services in some remote areas. This condition causes low level of awareness about health among community. This case has been started from education. In this world, health services need skill training so they can give the best treatment for all patients. As the result of the COVID-19 pandemic, many learning activities and practical works must be postponed. The greatest impact is felt for sectors that use practical work to develop the ability in the professional world. The development of current technology affects to maximum health services to support the efficiency of resources and finance. The health world has been a profession that has an important role in technology-based health services. The use of technology is applied to home care services to provide sustainable nursing care. Various innovations in health service continue to be developed, where important is one of the important elements that must be explored continuously so that the purpose of education can be achieved. In other words, the purpose of education to the provide equal right of education for all people and optimum quality of health services. In this pandemic era, innovation is not only a way to tackle the spread of the virus, but also we can keep to give health services with a most safety way. Nowadays, we enter the era VUCA. VUCA stands for volatile or always change. It means the dynamic or rapid environment change. Uncertain or not clear means that we must act with uncertain circumstance. Complex or complexity means that we live in a dynamic, loud and interdependent environment, and ambiguity means that we live in unusual environment and beyond expertise. Therefore, various health efforts must be carried out in a comprehensive, tiered and integrated manner. To support the success of this health development, various programs of health innovation are necessary to do. The COVID-19 creates high demands for healthcare institutions. They look for ways to survive and bring sustainable innovation for community quickly. However, this crisis may still be far from over, and the ability to innovate in health services must be improved to meet the challenge presented by both COVID-19 and economic constraints. Innovation in health services is a commitment of support between innovators and institutions to overcome the global COVID-19 pandemic. Ladies and gentlemen, in January 2019, Japan has just established Smart Society 5.0, which is considered a replacement for Industrial Resolution 5.0. Society 5.0 is human-centered and technology-based society in concept. Telemedicine is a form and implementing Society 5.0, and telemedicine as a long-distance health services allow patient health workers to communicate without having to meet face-to-face. Ladies and gentlemen, according to some topic, this seminar, we present the speakers who are truly competent, both as academic and practitioner. The topic raised are also our latest issues in the health sector, which are certainly interesting and important to study. The first, Professor Dr. Muhammad Nazil bin Saleh, Deputy Vice Chancellor Academic and International University College from Malaysia. Second, Dr. Bhumika Talwar, Maternal Health Specialist from India. Third, John C. Gomez, MANRN, Center Escolar University, Manila, Philippines. Fourth, Dr. Nur Baizura Muhammad Yusuf, Faculty of Medicine and Health Science, University Putra, Malaysia. And fifth, Dr. Dwi Prihatin Era, Spesialis Keperawatan Medical Bidah, Health Polytechnic of East Kalimantan. Through this seminar, we hope that it can improve our knowledge about the effort that we can do to optimize health services in Indonesia, especially for each region or province. Moreover, current innovation are supported by advanced technology and a lot of information from many sources, so that we hope there will be more new innovation from the health worker. We are very grateful to the participants who have enthusiastically participated in this seminar. I also thank to our speakers who have spared their time to share their knowledge to us. And thank you to all deputy directors, the head of division, and the head of study program in Health Polytechnic East Kalimantan, and all committee in this seminar. I hope this seminar will provide many benefits, especially in updating information about health services for all of us. Amin ya rabbal alamin. Success for Health Polytechnic East Kalimantan, and thank you for today. Wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Ah,
Welcome speech from Director of Health Worker Ministry of Health Republic of Indonesia, Ariyanti Anaya, Dentist Master of Public Health, and will be officially begin our conference for today. To the Honorable Miss Ariyanti Anaya, time is yours.
good morning and greeting to all of us.
Good morning, Miss
Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Nama Budaya, salam kebajikan, salam sehat untuk kita semua. The Honorable Director of the Health Polytechnic is Kalimantan, distinguished guest speaker, all participants, ladies and gentlemen. First of all, let's praise Allah Subhanahu wa Ta'ala, the God amenity for all of His grace, so that today we can attend on the International Health Conference on roles of research and innovation by health workers through health transformation, embracing smart society 5.0, held by the Health Polytechnic of the East Kalimantan. I share my gratitude and appreciation to all the faculty members of the Health Polytechnic East Kalimantan for organizing this conference. Ladies and gentlemen, as you are all aware, currently the Ministry of Health of the Republic Indonesia conducting a major health system transformation. There are 6 pillars of the transformation, which include the transformation of the primary health services, referral services, health resiliencies, health financing, health human resources, and also health technology. The transformation in health human resources include the 3 priority activity aiming to achieve the indicator of the RPJMM 2022 until 2024. There are the 3 priority activity include the fulfillment of the equality of the health human resources in distribution, increasing the competence of the health human resources through the competence-based health training and development of the functional position of the health human resources carrier. In a new era of the COVID-19 pandemic, extra effort that we already do and has been made to refocusing to continue of all the health program such as the non-communicable disease, maternal and child health problem, and community nutrition, disease prevention and control, and also health promotion and the healthy lifestyle movement, as we call it, GERMAS. To alive disease and to improve the Indonesian health, including the treatment and health development, is a challenging for Indonesian health system. In the 3rd pillar, if we are looking, the transformation of the health security system focused to increase the resiliency of the pharmaceutical and medical devices. Currently, the pharmaceutical sector is still dominated by import, and although there are more than 200 pharmaceutical industry from local investment, foreign investment, and state-owned enterprise, but about 95% pharmaceutical and medical device has been manufactured domestically. However, we are depend on imported the raw material of the pharmaceutical. But for the medical device, we still depend on import product. It's about more than I think now it's about 80%. And also in about that, so then we would like to do something to make the innovation and strategic to build the resiliency for the pharmaceutical and medical devices. The Ministry of Health encouraged to do the research to support the growth of the pharmaceutical independency for manufacture in the field of the vaccine, drug, and also for the medical devices and traditional medicine too. Because we have many resources for the traditional medicine, so we would like to build it too. Yeah, this happened because we know when we are dealing with the pandemic COVID-19, so we have a trouble because of the resiliency. More research, especially for the vaccine development, has been conducted during the pandemic. Production of the local health equipment has also increased rapidly. As a result, some importing activity for the medical device has been stopped because Indonesia can produce them, and we would like to do the limited to buy the import product, especially for the government budget. About 11% of the 34% of the imported medicine has been substituted with the domestic product, and this is certainly a good sign for the resiliency of the domestic pharmaceutical and should be sustained. To improve the quality of the health workforce, the government conduct many training and workshop. So we would like to improve the quality of the health worker to support the other transformation from the primary services and then for the resiliency too. And because of that, I am very appreciate to the Kalimantan Timur Health Polytechnic who implement this webinar and choose the theme of the role of the research and innovation by health worker through health transformation, embracing smart society 5.0. This theme will improve comprehensive understanding of the magnitude of the research and also innovation in all program management and every level of policy maker and executive. I hope this activity can be sustainable and provide a forum for various groups, both academic, practitioner, researcher, professional organization, and policy maker for the development of the science and technology so that it can improve health community globally. Dear fellow lecturer and student, on this occasion, I would like to express my deepest gratitude to the organize the committee for the trying to make this international webinar happen. We also express our gratitude to the participant who is joined this conference. So I hope this conference can give a good result, and develop many researchers that we needed to support the transformation of the reform of the health system, and also the research and the community services can be better in the future. I believe through this international conference, Health Polytechnic East Kalimantan can increase the knowledge and understanding of the lecturer, researcher, and also the student. And it will also improve the quality of the research activity in accordance with the with the target indicator of the Health Polytechnic Transformation Agenda. By the time I am confident it will be strengthened all over 10,000 primary care in Indonesia through the quality health human resources, and the research activities in East Kalimantan province will be able to contribute the nationality of the transformation on 2021 to 2024. Finally, I would like to thanks to all of you who have participated in this conference. I hope that you can get the fruitful conference and we can learn a lot from the crisis, and we would like to be a champion in the future for achieve our global, especially for fight of the after pandemic COVID-19. Most importantly, people must stay productive and live with a healthy style. And that's my message. So then, once again, have a wonderful conference. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for Director General of Health Worker, Ministry of Health Republic Indonesia, Ms. Ariyanti Anaya, Dentist Master of Public Health, for officially begin our webinar today. For as the contribution for attending this conference, we will giving you a virtual certificate from our director to Ms. Ariyanti Anaya. To Dr. Management Haji Supriyadi, Master, time is yours.
Assalamualaikum Bu Dirjen.
Waalaikumsalam Pak Direktur.
Terima kasih Ibu.
Apa kabar?
Alhamdulillah sehat, mudah-mudahan Ibu sehat selalu. Terima kasih sudah berkenan meluangkan waktu di setengah kesibukan untuk bisa hadir di acara International Conference Poltekkes Kalimantan Timur yang kedua di tahun ini. Terima kasih sekali Ibu.
Ya, sama-sama. Sukses ya Pak Direktur ya.
Terima kasih,
Apresiasi buat Pak Direktur dan tim.
Makasih Ibu supportnya. Kami serahkan sertifikatnya ini Bu kepada Ibu Dirjen. Terima kasih Ibu.
Terima kasih Pak Direktur dan tim, Pak Wadir semua.
Ya, terima kasih Ibu.
Sukses ya konferensinya ya.
Terima kasih Bu.
Okay, thank you once again for Mrs. Ariyanti Anaya, Dentist, Master of Public Health. Okay, now to the other participants. Our next agenda is presentation from our great keynote speakers. But before our speaker give you the presentation, I would like to say something to you all. You have to make sure your microphone is mute and your camera is on, so we can focus on our keynote speakers.
And the question will be answered after all the keynote speaker has presented the presentation. Yet the participant could write the question in our comment section on Zoom or our YouTube chat section.
Okay, let's get into the main event, the presentation of the seminar by the speakers, which will be moderated by Rizka Indah Mulyani, Master of Science. Please welcome Mrs. Rizka Indah Mulyani, Master of Science.
Yeah, thank you very much, MC, and good morning, ladies and gentlemen. Welcome to the IBICH, or the second East Borneo Health International Conference. The main topic of this conference is about roles of research and innovation by health workers through health transformation, embracing Smart Society 5.0. And my name is Rizka, and I'm going to be the moderator today. As we know that the Ministry of Health in Indonesia is preparing 6 pillars of health transformation to handle public health problems. The pillar number 6, or the 6th pillar, is related to the transformation of the health technology system and for entering Smart Society 5.0. And this also can be realized by doing many research and innovations in the health sectors. And for that, we have two speakers who are already with us. And the first speaker is Professor Dr. Muhammad Nazil bin Saleh from University College MAIWP, Malaysia. And he's currently working as Deputy Vice Chancellor Academic and Internalization. And the second speaker is Dr. Bhumika Talwar from United Nations Population Fund, and she will be joining with us later on. And I'd like to greet Professor Dr. Muhammad Nazil. Are you with us now?
Assalamualaikum warahmatullahi wabarakatuh.
Ya, waalaikumsalam warahmatullahi wabarakatuh. Yeah, hello.
Okay, yeah, alhamdulillah. Thank you very much. Actually, I'm trying to share my slide, but I think there is a problem here.
Yeah.
Okay.
Maybe you
okay,
can
let me try.
Yeah. I'm sorry, Professor, but I would like to explain maybe some points during this session. Yeah.
Okay, sure. I think now it's fine.
Oh,
yep.
Yeah.
Yeah.
Yeah, I can see the slide, the PowerPoint. Yeah, so this session will be divided into 3 parts. So this is information for audience, yeah. And the first part is the presentation from the speakers. So each speaker will present his or her work for about 30 minutes. And then the second part is question and answer part for about 15 minutes. So all the audiences can ask your question by raising your hand, or you can write your question in the chat box. And the third part is closing and taking the conclusion. Okay, I'm going to invite Professor Dr. Muhammad Nazil, and I think you have about 30 minutes to present your work, yeah, and time is yours.
All right. Thank you very much, Madam Rizka Indah Mulyani, our moderator for today. Honorable the Director General of Health Workers, Ministry of Health, Republic of Indonesia, and all honorable and VIP guests. Thank you for inviting me to be a part of the speaker for the second East Borneo Health International Conference 2022. I believe this is a part of the Campus Merdeka Indonesia Raya, broadcast by Kaltim virtually, I believe. All right. Okay. Okay. I think I can start now. Okay. All right. All right, the title given to me is the Innovation in the Medical Technology Era, IR 4.0 and Society 5 of the Healthcare Provider. All right, okay, the Industry 4.0, I think, I believe, is the new trend, is the revolution is already in defining how we manufacture things today, and we believe the trend towards a fully connected and automated production system that can predict and improve the performance of the system. And from that, we also believe that the Society 5.0 also was proposed in fifth science and technology based plan as a future society that Japan should aspire to.
I'm sorry, Professor.
It's not only.
I think the
Sorry?
PowerPoint has not been seen yet by the audiences. I think you not share the screen yet.
Oh.
I'm sorry.
Oh.
I think audiences cannot see the PowerPoint.
Okay, let me try.
Yeah.
Share with them. Okay. Okay. Do you get the slide?
Not yet. Not yet.
Is it all right now?
I think the screen is only half part, yeah, so it's not fully screen. Yeah. Is it okay? Committee, how is it? Yeah. Yeah. Yeah, you can continue your presentation. Yeah.
All right. My title today is the innovation in the medical technology era, IR 4.0 and Society 5.0 of the healthcare provider. I think the slide. All right. I think we believe that the Industry 4.0 revolution is already in defining how we manufacture things today, and the trend towards a fully connected automated production system that can be predict and improve the performance of the system. And the combination between very important is the 5.0, where we bring the skill together, together with the technology 5.0. All right, so we can see from here the revolution of the from the 18th century up to now. We can see the performance. All right, this is the 19th century, the second industrial revolution. And you can see the increase of the capacity of the production. And the third industrial revolution, whereby in the 20th century, so you can see everything using the computerized and also IT technology. And now we are in the revolution 4.0, whereby the big data is a very important to connect it between one to another to make it more connecting between the manufacturing and also the real at this point. All right. Then after that, we have to look on the very important regarding the Industrial 4.0, whereby we believe is starting from the university. We can see from the ideas and the ideas from the ideas normally from the all the people, we can create the innovative minds, and finally we can create the critical mass. I believe in Indonesia or in Malaysia or other country in the world, they are start thinking from the bench to the industrial, how to promote the product from the R&D towards the to the public and also the industrial. And I believe in the medical equipment is a very important, how we create the product to the industrial advantage. All right. From that, I believe the merge of the digital technology and also the internet is a conventional industry to materialize the product, whereby the science we look into from the genomic. Now we're talking about the transcriptomics and also proteomics, and finally to metabolomics. This is the way how the industry on the medical technology to look and to search what is the important criteria to develop certain detection of the diseases from the genomic up to the metabolomics. And from here, we can see in era 20th century, IOMT, which is the Internet of the Medical Things, is a very important. We can see from the clinical efficiency, and then I believe people start using the home monitoring, which is a smart home, and then we also look on the fitness wearables, and also we can see on the medical, they can detect infant monitoring from the beginning. I believe that, for example, they look on the paternity and also to detect any diseases at early stage of the pregnancy. And from that, we also can look on the way how the people nowadays look on the biometric sensor, whereby they can look their health status time to time, and also on the brain sensor neurotechnology, how the brain the connecting between neuron to another parts of our brain. And finally, we also can look on this. Nowadays, people try to look on the sleep monitoring to have a good sleep before they wake up for the next day for working. And here there is about 12 elements that already covered and also already discussed in, I believe, in 2021. There is about 12 elements that people look into it. There is very important on the industrial 4.0 application in the medical field. You can see from the innovative service to the patient. I believe it's very important nowadays, even though in the COVID-19, people look everything using the digital, how to monitor the health status time to time. And I think in Malaysia and also in Indonesia, you also have, like in Malaysia we call My Sejahtera, and I believe in Indonesia they are using Peduli Lindungi to check the status of the patient. And from that, we also can look on the patient data analysis, whereby you can see from the the COVID-19 scenario, people can look on the data analysis, and then from that they're using the artificial intelligence to look where is the location and also where is the patient spread the disease. And there is other things that I believe is a very important nowadays, is a connecting between the the IR 4.0 and also the technology. All right. So from that, it's a very important. We look on the higher institution, because the higher institution is the main we can say is like a factory whereby we can look on the knowledge. From that, they can increase the efficiency on certain product they produce, and this will be create the new industry in the universities and also the country to enhance the technology by then. Then finally, we believe from the what we produce from the university, we can create a new companies and we can give the opportunity to the job. And finally, from the industrial, we can return as a tech player. And finally, back to the government to funding the research in academic. This is a very important workflow, and it's a very important technology and model that I believe already implemented in Malaysia and also in Indonesia right now. Apart of that, the collaboration between higher institution also is a very important. We can see from the research element, and then on the education. Finally, we have to back to the community outreach, whereby we work together with the government agency on the certain thing. Finally, we have to collaborate with the private enterprise to make sure the quality and also the product that we produce can be benefit to the community out there. And I believe in the research activity, there is a lot things we can highlight it. For example, we're talking about the basic research element. There is a core strength in the biomedical science. For example, we're talking about the basic science. Then finally, we look on the human application, and we move forward on the clinical application, finally on the clinical practice and also public health impact. And finally, we need this kind of the ideas and also the technology to be implemented in the industrial. And this is a part of, I believe, already migration between from the basic science research up to industrial. And at the same time, we have to look on the people, how we give the skill to make sure that these people also can contribute on the skill factors. All right, this is the model that available in the market. We're talking about the bilateral agreement, focusing on the academic and also research cooperation, and then I believe involvement of the faculty and also higher institution. And the second one, we're talking about the global research and also the academic network of the university on the niche area that they are looking for. This is a very important that we have a collaboration between one country to another country, whereby we can explore as a part of the primary partnership to look on the certain area that we are focusing on the specific disciplinary. I believe there is a lot of the collaboration, networking between one country to another country. And finally, we're talking about the strategic international collaboration with the reportable university. This is the final that we are looking, for example, like between one country to another country and a good university to enhance the findings, to look all the capabilities from the two expertise between two countries. Okay, this is an example that having in our university, we have a strong collaboration between our university with the Radiolab Diagnostic Sdn Bhd in Malaysia. During the pandemic 19, we managed to come out with a collaboration to detection, as the screening and also to run the RT-PCR. So basically, we run about 40,000 sample by the people in Malaysia, and this is part of the collaboration between universities and also the industrial. I believe in September 2015 by the United Nations. They already come out with a 17 new SDG. I think this is a very important, whereby you can see from the first until the 17 SDG, and they also incorporated with the Society 5.0, whereby it's a very important. Now this we look this kind of the parameters, and during pandemic COVID-19, I believe there is about 255 million people lost the job. You can see people looking for the job because of the pandemic. There is no job available. Only the certain sector that can run the businesses. And I believe by SDG 8, you can see from that the decent work and also the economic growth is very important. They're talking about by 2025, we have to look the 5 elements is a very important on the Society 5.0, whereby they look on the future of the work. We're talking about the skill. This is a very important, and also we're talking about the social protection floor, and also youth employment, and also the rich economic growth. From here, you can see the demographic that already presented in WHO. You can see like a gender. Now this, I believe, all over the world, the female in terms of education or working people increases to women compared to men, and also the numbers of people working also already increased. You can see from people like 25 and above, they are start working, and this is the trend that after people finishing the high school, they are intend to work rather than go straight to the higher education. I think this is a part of the long life learning. And you can see from the demographic also, you can see like the people intend to work in the private sector rather than the government sector. This is a very important on the polar of using the technology, using the IR 4.0. Without the skill, we can having difficulty issue later on. That's why the Society 5.0 have to embed it with the IR 4.0 to ensure there is a stability in terms of to producing people with the high skill workers. And we can see from here there is 3 big element that we have to asking ourselves regarding the what changes will IR 4.0 bring. So we have to question and to answer between the IR 4.0 and also the Society 5.0. And this is the important element, I believe, is already embedded in the curriculum of the majority of the universities, that we look on the workforce readiness, and then we look on the soft skills. Technical skills is very important, even though we are using the machine, we use a device, but the fundamental on the technical skill also is very important. And the element of the entrepreneurship also will be embedded in the curriculum of the syllabus in the university or in the higher institution, whereby we try to ensure that the young generation, they also can using the knowledge, and finally they can work their own. I believe if you can do some survey, a lot of people, they are intend to do like to do the business. For example, like reviewing products, you know, they can get extra money. Majority we can see a lot of people using Instagram. They're talking about the TikTok, using this kind of platform to selling the product. At the same time, they are also in the higher education. And this is another skill that we have to look into it. It's a very important. Even though we have discussed critical thinking and also and finally, we believe, based on the combination between the IR 4.0 and also Society 5.0, we can look the validity and also the high quality of life. This is a very important. For example, I recently went to Korea that they are using robot in the hospital, and then the robot will be communicate with the elderly people, because I believe when people in the hospital sometimes they are a little bit lonely, because there is no people want to listen or communicate with them, then they're using a robots to as a part of the community to make sure these people will be have friends and also can communicate when they're asking the question to the to the people. All right. This is a way forward. I believe people already know how is very important on the future of the life. I showed this video to all of you.
I'm sorry, Professor. We cannot hear your sound.
Sorry.
We cannot hear your sound.
Oh.
Oh, the video. Yeah.
Oh, yeah. It's a video.
Oh, this. Hear the sound of your video. I'm sorry.
Do you?
Scientific breakthroughs at a rate that will increase exponentially as technology continues to evolve to integrate into our lives. Talent care individual is the advanced capabilities to capture, interpret, and act on perfect data in real time so rapid change. This change will require a rebuild of today's healthcare system and the collaboration of several actors, some old, many new. Those with deep roots in care delivery express themselves in use data and technology to transform what well-needed care delivery needs. Players in the health ecosystem non-practitioners. For example, those focused on the data platforms and tools that enable this. Regulators, financiers, intermediaries, all play a big role in inclusion. Disruptive thinking and emerging technology are more important than ever. Because the future is for all succeeds.
All right. right, you can see from the the video is a very important that we have to cooperate between the technologies and also the society 4 and 5, and that is the direction of our world and also our generation towards the future of the health. All right, that is.
They provide innovative minds and create critical mass, and then a lot of research and innovations have been created using digital technology and internet. Furthermore, the research in the scale of genomics and metabolomics are currently doing by many researchers, and then common collaboration are necessary to do between research, education, community and private enterprise, and also skill categories are needed to implement 4.0 such as workforce readiness, soft skills, technical skills, and entrepreneurship. Yeah, and then we would like to open a discussion, question and answers session.
Yep, sure.
Yeah, okay, all the audiences. All the audiences, you can raise your hand or you can type your questions in the chat box. Sorry, because it's a bit, there is a technical problem here.
Okay.
Yeah. Maybe a question for me. I'm still wondering about how do you implement health technology system in your country, Professor? In Malaysia, maybe.
Implement the technology system.
Health technology system.
All right. Okay. When you're talking about the health technology system, I believe, I think it's not only Malaysia. I think in Indonesia and also other countries, they are start using the you can look at from the smartphone nowadays. Even though like us in Malaysia, we start using the smartphone for the appointment in term the health system. For example, for the appointment to see the doctors, and then the result also basically will be will be delivered by the phone nowadays, because this is a part of the technology. Like we try to ensure the busyness in the hospital can control. Rather, otherwise, like people like go to hospitals without make any appointment. For example, that is the part of the the system healthcare in Malaysia. And I think for example, like tracing the result nowadays, we also can get through our device, whereby you can get all the result regarding your health status through the apps application already implemented in Malaysia and also the other countries. On top of that, for example, like nowadays, we also have like system like purchasing like medication or also drugs. For example, we have like door-to-door delivery, whereby the patient doesn't cannot just sitting at the home, then they can receive all the medication or the drugs to the post, or they can receive from the delivery from the hospital as well. That is the part of our movement in the healthcare information or healthcare provider. Did I answer your question?
Yes, thank you, Professor. Maybe
Yeah.
other audiences would like to ask some questions. Let's see in the chat box if there is a question from audience. Yeah, Mr. Amiruddin Mhum, yeah, would like to ask a question, maybe.
Okay. Good morning, Prof.
Good morning. Good morning.
I have a
Assalamualaikum. Yep.
question about uh, uh, how culture in your state influence your innovation.
Your question is how my country culture
Yeah.
regarding the
Culture in
innovation.
your state.
All right. Okay. I think it's a good question. I believe when we're talking about the culture regarding innovation, in Malaysia, we already started from the primary school, because I believe this is a part of the culture that they ask a student to look or design something regarding the innovation, and they also have the competition between one school to another school, from the province, for example, state, until to the country. This is a part of the way we culture and enhance the innovation in Malaysia. And it's not only that, we also have involved in the international competition, where we believe from the school, and also collaboration with the certain universities, they can help the student in terms of to generate their own mind, and also give them a proper critical thinking in terms of to solve the certain issue, or to create something innovative. That is a part that we are doing right now. And some school, they also have collaboration, and also they call sekolah angkat, for example. They can bring them to the university or to the hospital, to ensure that these people have that kind of spirit to look what is the direction, what is the future innovation regarding medical all about.
Yeah. Okay, Prof. Thank you for your
Thank you.
explanation. Yeah. Thank you, sir.
Thank you.
Yeah, maybe other audiences would like to ask question. And yeah, I'm still wondering one more question from me about the skill
Yeah, sure.
categories. Yeah, I think it's interesting. Yeah, because we are not only talking about how is it say smart and technology always, but we have soft skill. Yeah, and then workforce readiness. Yeah, I'm still wondering about that. About workforce readiness. Yeah, can you explain me more about that and soft skill? Yeah.
Okay, thank you for the question. I think the workplace readiness is very important, that we're talking about the ambient, we're talking about the support system in our work place. Either we are readiness to cater in terms of facilities, for example. I believe nowadays people talking about the digitals, people talking about a lot of the device available in the world, in the market, for example. Then either we are as higher institution are ready to bring this kind of the technology to our facilities in our environment to ensure that the workplace and readiness in terms of the the lecturers, for example, like docent, I think about the student itself, either they can benefit from the output of the technology. That is the one thing that I believe is a very important. We look into that, and we can say, for example, like I think about last 3 years, last 4 years, people talking about there is no platform to communicate. We are having the we're having difficulty to communicate between one country to another country. For example, now I think we can discuss every single day, and I believe some of us, like like having meeting like day and night. For example, there is no limitation because we are using this kind of the technology. That is the one thing. And another thing, we're talking about the soft skill. Soft skill, I think, is a very important because people look on the device, but the soft skill is a very important. We're talking about, for example, like us, we deal with the human. We're not talking about we deal with the robot, right? So soft skills is very important. We're talking about the eye contact. We're talking about the body language. We're talking about the emotion. We talk about the feelings. It's a very important, especially when we work as the frontliners in the healthcare provider. It's a very important to culture to embed it of the soft skill among academia, and also to the students, whereby it's not only using the platform. For example, like we have like virtual classroom, we're talking about a virtual lecture, but skill and also the other element also is a very important to ensure that we not eliminate the soft skill between human to human. That is a very important for me. We have to balance it. Between the technology I 4.0. Now we're talking about the move forward to I 5.0, and also the society is very important. We have to balance between these two elements.
Yeah. Thank you, Professor. I agree with your statement that we need to balance between the technology usage and the human also use that technology. I really agree. Okay, maybe other committee in this room would like to ask a question, maybe? Yeah. Oh yeah, Mr. Badar. Okay. Mr. Badar, you can ask your question to Professor.
Well, thank you for moderator for giving me a chance. I would like to thank for Professor Nazal. Good morning, Professor.
Good morning. Assalamualaikum.
Okay, I would like to introduce myself. My name is Badar. From East Kalimantan. Here that your explanation very excellent and very good. So my question is, the more benefits in your country, how benefits compare before your research, how benefits for, especially for society.
Sorry.
Right.
Oh yeah.
Yeah.
I think I can I repeat your question? Either is correct or wrong in terms of my interpretation. You're talking about the benefit
benefits
on
of
the
special
R&D
for society.
Society. Okay,
Yes.
I think there is another that we look into it, whereby in Malaysia we have like grants, okay, for the community, whereby the grant is available. I think almost all the ministry in Malaysia, for example, like people in agriculture, for example, they can get what I mean benefit in terms of grant available in the Ministry of Agriculture, for example, to enhance on the certain what I mean R&D or certain finding on the agriculture from the community. And in the higher institution, we have like what I mean the under Ministry of Higher Education, we also provide the grants for the R&D, and we are cater from the basic what I mean fundamental grant until the matching grant as well. So the matching grant, whereby if the product already available, already tested for the prototype, they can using the matching grant between what I mean the companies that already introduced by the Ministry of Higher Education to the researcher and also to the industry. This is the way how we do it to ensure that all the what I mean the technologies, all the IPs are already cascade between the what I mean the inventor to the what I mean to the industrial that can provide the what I mean the the big what I mean production, for example. So we have that kind of a matching grant as well, so to ensure that all the what I mean the IPs already invented by for example from the scientists, to ensure that that product belongs to them, then can be shared and also can be secured under the certain industry, to ensure there is no like backstab from other people, you know, like this is when we're talking about the innovation, people can, you know, like copycat other people work, for example. So to ensure that things happen, normally we have like a matching grant, so that already like what I mean confirm the what I mean the project will be engaged with the what I mean the industrial. That is the way how we do it, to ensure that there is no what I mean people sabotage other people work, something like that. So that is a part of the what I mean the culture has been implemented in Malaysia right now. Did I answer your question?
Okay. Yeah. Pak Badar, is that answer your question? Bagaimana Pak, sudah menjawab? Masih unmute ya sepertinya.
Yes, I got your explanation. So,
Alright.
may I continue my question?
Yeah, sure.
Yeah, thank you. Talking about research, it's maybe difficult to do, especially for me, maybe. So, would you please give me a strategy or tips maybe for make it for make research easily?
All right. Okay. The tips and tricks. Okay. I think that is a good what I mean question to I believe to everyone. I think the first thing what we have to do, we have to engage as a group. What I mean as a group researcher, that I believe that I already implemented that we have a group. We cannot work as alone, and we have our assessor as well. For example, like we are the highest what I mean academic staff, and then you have the grants, so we have to work with other professor or other researcher as well. because that will be motivate and also to calculate our motivation or our direction, and from that you can have your own community among the researcher, among the academic staff on the same niche area. Then after that, from that, we can start look to other country, for example, nearby. For example, like Malaysia and Indonesia, for example. Like for myself, I have like collaboration with the Universitas of Indonesia, for example. So we have mutual understanding in terms of the expertise. For example, like my research more on the, for example, like genomics. So we have other professor from Indonesia in expert in, for example, like toxicology, for example. So we work together. This is a part of way to inspire everyone on the direction. And let's say like I have my own grant, I'm also invite people from Indonesia is a part of to ensure that we have a very strong collaboration. That is the way how we do it, and I believe people in other country also do the same thing. Yeah. So maybe we can start the small thing, but finally once we have it, the things materialize, then we can start move forward on the second step, look on the big grant example. I think I start last time with the 20,000 grants, and now more than 500,000 grants, and then 1 million grants, something like that. So we have to communicate and come up with our own research activity. Yep.
All right. Thank you very much.
Yep. Thank
Professor
you.
Nazil.
Yep. Thank you.
Yeah, thank you, Professor Muhammad Nazil and Pak Badar, yeah, for asking question, yeah, to our speaker. If there is no question anymore from participants, we would like to give you virtual certificate as your contribution for the first speaker in this conference. Yeah.
Thank you.
Here you can see the certificate here.
Yep.
Yeah. Okay. Thank you, Professor Dr. Muhammad Nazil, for giving
Thank you.
and sharing, for giving and sharing such an interesting topic, yeah, especially.
Yep. Thank you.
Smart
Thank you for
society.
inviting. Yep.
Yeah. Okay.
Yeah.
Maybe we can meet again, yeah, in the soon in the next conference. Yeah.
Inshallah.
Inshallah. Yeah. Thank you.
Okay. Thank you.
Yeah. See you. And the next is we can move to the next speaker, Dr. Bhumika Talwar from United Nations Population Fund, India. Yeah. Are you with us now, Dr. Bhumika Talwar?
Yes, I'm very well with you.
Yeah.
Am I audible?
Yeah.
So I have
You're
sent my
audible.
presentation to one of your colleagues. It's a request that please display my presentation.
Yeah, you have about 30 minutes to present your work, and time is yours.
So can you display my presentation?
Sorry, pardon.
Can you display my presentation?
No.
So can you, okay, let me do that.
You can open your camera now.
Yeah, my camera is open
Please,
already. So are you not able to see me? Let me
I
see
cannot
once
see
again.
you, but in the
This,
No,
I
yeah.
think,
It's not seen
we're
yet
not.
because I'm sorry.
There must be some technical issue. Let
Yeah,
me share
true.
my screen.
Maybe you can try.
So, are you able to see my presentation now?
Yes, I can see your presentation.
Okay, so I'll do one thing. Let me start the presentation and let's see how my camera, what is
Yeah.
the issue with the camera. Is that okay?
Yeah, okay.
So, okay. So first of all, I would like to congratulate you and your team and greetings from the India to the beautiful Indonesian people and congratulate to the entire team, the directorate people and the higher officials for organizing this workshop and inviting me as a speaker. And I would also send my greetings to the other country people also. So if we talk about India, India is when we see that India is a number, we have a lot of population, and when we talk about the Indian government is very focused and ready to spend on the healthcare sector. So when we see there's a universal health coverage, which we call as Ayushman Bharat, under the Ayushman Bharat, and the government of India has two systems. One is the health and wellness centers, and second is the PMJ. Under the health and wellness centers, we have a comprehensive primary healthcare coverage in which we have strengthened the tertiary, secondary, and primary care by preventive, promotive, curative, and rehabilitative care. And under PMJ, we impanel the government of India impanel the public and private sectors. So if we look the rollout of the health and wellness centers, we will see that till December 2020, we have 1.5 lakhs health and wellness centers. And since inception, we started from 17,000. And now it is 1.5 lakhs. So we have still not stopped during COVID times and continuously growing in 2020 and 2021. So the basic service packages, we are giving 12 service packages, but initially we are focusing on 7. That is care in pregnancy and childbirth, neonatal and infant and healthcare services, childhood and adolescent healthcare services, family planning, management of communicable diseases, national health programs. Then we have a general outpatient care for illness and medical ailment. We more focus on the non-communicable diseases. There are few services which we are going to incrementally provide in an incremental manner. That is basic oral health care, screening and basic management, care for common ophthalmic and ENT problems, elderly and palliative care, emergency medical services include. Now, if we talk about India and its community health and public health, our ASHA is the main pillar. We have a 3 A's, ASHA, Anganwadi workers, and ANM, in which ASHA is emerging as the first contact point in the local community, particularly healthcare seeking for women and children. And as a government, we provide her incentives as a routine and recurring to rupees 2,000 per month as a part of ASHA benefit package. Not only that, the government has also enrolled ASHA in various schemes like Pradhan Mantri Jeevan Jyoti Bima Yojana. There is a scheme of premium of 330 contribution by the government of India, Pradhan Mantri Suraksha Bima Yojana, in which will contribute premium of rupees 12 contributing by the India, and Pradhan Mantri Shram Yogi Man Dhan Yojana. So if we talk about India, we have various free initiatives because our concept is to provide the free services to our people. That is free drug initiative. Similarly to NABH, we have a NABL accredited labs to ensure quality of drugs. And then we have EDL, that is essential drug list in all the facilities at PHCs, CHCs, and the other district hospitals. So currently we have 105 at sub-health wealth centers, 170 at PHC level, 229 drugs, free drugs at CHC level, 311 at SDH, and 375 at DH level. When we talk about the free diagnostic initiative, we have a free services, and we actually the guidance note was circulated in all the states as a hub and spoke model. So if we see that we have expanded our range at sub-center, we have 7 tests which is completely free of cost. At PHC it is 63, CHC 97, and district hospital it is 134 tests. Now we have a national ambulance services in which we have 102 service which provide basic service to the basic patient, as well as it is free for all the pregnant women and infant up to the 1 year of age. If a pregnant woman want any services related to their pregnancy, or if a sick infant is there, they can utilize the services. Then we have a dial 108 in which if patient is a critical care or in trauma or accidentized, they can use this services where we have a BLS support. Then if we talk about how we support our HR under NHM, we have a very lucrative salaries offers. We have a fixed tenure posting, performance-based incentives. I can move forward and tell you like where there's key strategies. For example, creation of posts in the health facilities as per the Indian public health standards. These are basic standards in India, which we follow. And then we integrated with HRH planning. Then creation of specialist cadre. And a public health management cadre has already been established, and the guidance was circulated in 2022 to ensure the availability and needs-based rational deployment. Then we have employment of comprehensive HRS evidence-based making. Then we have a one big quote that you quote we pay in order to provide the HR in hard reach areas. We give the services and the money to the gynecologist and the pediatrician and the high skilled specialist as the way they want. Then we have a hard area along to the medical officers and staff nurses. We have a performance-based incentives. Then we have fixed tenure posting recommended. When before posting, we ask the HR that where they want to get the posting, if they want their posting at their hometown. So we are ready to accommodate them along with their spouse. So we have a DNB in district hospital to increase the availability of the specialists. Now, if we talk about our quality assurance, so India is very keen into a quality assurance program as the other countries. We have a national quality assurance standards for district hospital, CHC, PHC. Then we have a Lakshya for the labor room, ensuring quality of care during delivery. Then we have a Suman, Surakshit Matratva Aswashan, which is called NQAS, which is certification of Suman services. Then we have Muskan, that the quality certification of pediatric services. Then we have a Kayakalp, Swachh Bharat, Swasth Bharat. Then we have a AEFI surveillance, ensuring quality in AEFI surveillance. And then we have a Mera Aspatal, where we capture the voice of the patients. Various IT initiatives is the health management information system where government is capturing the monitoring information. We have a RCH portal in which we have early detection and tracking of individual beneficiary throughout its reproductive cycles, and we capture antenatal, postpartum and all the delivery care services. We have Enmol, which is an application-based services of the RCH portal, and the tab is provided to all the ANMs. Then we have the NCD app, digital setup used for the NCD screening above 30 years of age. Then we have Health and Wellness Center portal, where the daily reporting and monthly services is provided. We have a Nikshay portal, which is for the TB, monitoring of universal access of TB. And recently our slogan is TB Harega, Desh Jeetega. Then we have DVDMS, that's a Drug and Vaccine Distribution Management System. And in this, automatically the workflow of the procurement and the supply chain and quality. Then we have EVEN, that is a globally acclaimed portal in which the electronic vaccine intelligence network, in which we digitalize the entire vaccine stock and manage it. Then we have family planning logistic management information system and the Mera Aspatal. We have the hospital information system in which we have the e-hospital application. PMSMA portal for the tracking of all the high-risk pregnancies in the PMSMA day. We celebrate PMSMA day on 9th of every month, and we have an integrated disease surveillance program, real-time tracking. Now, if we talk about what is the Pradhan Mantri Ayushman Bharat infrastructure mission, in order to strengthen the infrastructure under the universal health coverage, we have launched the PM Abhim. Its main mission is the central sponsored scheme and the central sector component, in which we have to strengthen the urban and rural health and wellness centers, block public health unit, integrated district public health laboratories, critical care hospitals, critical care blocks, strengthening surveillance of infection diseases, outbreaks. And this outbreaks is actually come out after the COVID. We realized that we need to strengthen this COVID response and epidemic preparedness. We need to prepare our country for this. Now, if we talk about the reproductive maternal health, we are catering the 3 crore pregnancies in India. And if we see the MMR, the global MMR of our India is 103 per lakh live births. And if we talk about the national health policy, it is claiming 100 by 2020. And by the SDG, we need to achieve by up to 70. If we talk the neonatal mortality rate, it is 20, and we reached to go below 12 by SDG. If we talk about the infant mortality rate, it is 28. Then total fertility rate is 2. And we actually claim that recently there was an international conference of the family planning, and India stood the first rank in the entire country. So if we see the maternal child mortality as per the SRS, we can see that India is still moving and working hard towards achieving this. We have still high MMR in various states like Assam, Uttar Pradesh, Madhya Pradesh, Chhattisgarh, Rajasthan. So we feel that yes, we need to work really very hard to move this. So the entire innovation and researchers are focusing on this. Now, the key RMNCHA areas are reproductive health. If we see that 56% the prevalence of modern contraceptive use. So the research is to increase the prevalence of this usage. Still, we have 57% anemia in women of reproductive age group. In spite of several efforts and in spite of various programs like Anemia Mukt Bharat, still we are not achieving and increasing our progress in decreasing this anemia among women in the reproductive age group. Unmet need for the family planning is 9.4%. So if we talk about the maternal health, 70% ANC is within first trimester, 58% at least 4 antenatal care visit. So our research area is why it is not increasing and reaching to 70%, and what is the actual issue that why the pregnant women are not receiving the 4 antenatal care visit, in spite the WHO has claimed 8 contacts. The 52% pregnant women are anemic, 14% C-section rate in public healthcare facility. In newborn and child health, 64% are exclusively breastfeeding, 7% prevalence of diarrhea, 36% children are stunted, 67% children are anemic. So if you see, the anemia is a strong prevalence in India. So this is the major research topic for us. 4% is unmet need for spacing, and in adolescent, 23% women aged 20 to 24 years marriage below the age of 18 years. Yes, it is very sad to say that in India, we have a teenage marriages are very prevalent, and same as a teenage pregnancies. So various strategic interventions we have done. We, as the RMNCHA, we have the basket of choice approach, home deliveries of contraceptives, Suman, JSY, JSSK, PMSMA. Then we have, for neonatal, we have FBNC, HPNC, HBYC. I'll explain you once I move on. Then for child, we have an immunization, diarrhea control program. Then for adolescent, we have RKSK and WIF. And for newborn, we have the Poshan Abhiyan and NDD. So when we go for the family planning strategies, we have expansion of the basket of family planning choices like injectable MPA, Centroman, training on newer contraceptives we are providing. We have availability of postpartum IUCD services, training, and we actually train healthcare providers in all the healthcare facilities. Then we operationalize the fixed services for sterilization. We are putting the camps, mini lab, LSV camps, and under the mission Parivar Vikas, we are delivering the assured services by devoltizing the promotional schemes. In key interventions, I already told you Mission Parivar Vikas, newer interceptives, then PPIUCD, and we also globally in the World Population Day campaign, vasectomy fortnight, and yes, the National Family Planning Indemnity Scheme, which is very, very important and actually successful in India. So in Mission Parivar Vikas, we have a supply side and demand generation strategies. We revise our sterilization compensation processes, operationalize all the delivery points for PPICD, incentivize schemes for injectables, MPA scams. We have a dedicated workforce for family planning services. Then we have distribution of Nayi Pehal kit. What is Nayi Pehal kit? Is we distribute the kit in which we have the lipsticks and sandoor and other accessories for a newlywed couple, and we ask them to use the basket of choice, either the use of the condom and keep a spacing methods. Then for the maternal health, we have Surakshit Matritva Asashan, Janani Suraksha Yojana, JSY, Pradhan Mantri Surakshit Matritva Abhiyan, Lakshya for the labor room strengthening as a very common midwifery initiative, then maternal and perinatal child health surveillance response for catering and capturing the each and every maternal death, as we are committed to prevent maternal deaths. We have a universal screening for GDM, comprehensive abortion care, capacity building, MCH, infrastructure strengthening. We have a MCH wing and obstetric HDU ICU. Then, and we have the first referral unit in each and every district. So under Suman, it is a multi-pronged and coordinated policy approach that subsumes all existing maternal health initiative under one umbrella in order to create a comprehensive initiatives. So our initiative for zero preventable maternal and newborn deaths. Its pillar are intersectoral convergence, community linkage and support. Award to Suman champions. Yes, in this we identified champions from the community and we'll provide and we'll facilitate them by doing their good work. Maternal and infant death reporting and reviewing. Grievance redressal mechanism. As I told you, 104 we have call center. Client feedback mechanism under Mera Aspatal, response for women's autonomy, dignity, feeling and choice, and assuring services guarantee with no denial of services. If any pregnant woman reaches to any hospital, there should not be any denial of services. This we actually ensure. The newborn and child health, we have various strategies like essential newborn care, facility-based newborn care, pediatric care. Then we have kangaroo mother care, routine immunization, stillbirth. Under nutrition, we have Anemia Mukt Bharat, nutrition rehabilitation centers, IVCA promotions. For pneumonia addressing diarrhea, we have IMNCI, promotion of ORS and zinc. We have a SARS program. Then RBSK, that is Rashtriya Bal Swasthya Karyakram, we have a screening at delivery point for birth defects. And universal immunization program, our annual target is 2.6 crore newborns and 2.9 crore pregnant women. So this is one of the largest public health program and approximately 1 crore sessions planned every year. If we talk about the Rashtriya Kishori Swasthya Karyakram for the adolescent, we have the facility-based approach. We have adolescent-friendly health clinic where they cater all the problems associated with the adolescent health. We have a school-based approach and where the Ayushman Bharat School Health Wellness Ambassadors Initiative, in which we identify the ambassadors in the school, like those teachers who are doing good. They work as a role model and they teach and train our adolescent about the do's and don'ts and what is the positive, healthy and friendly services. We have the menstrual hygiene schemes in which we distribute the sanitary napkins and the anemia and we have the iron and folic acid supplements to curb the anemia. We have a community-based approach as the Adolescent Health Day, which is organized quarterly to increase the awareness about adolescent health, and peer educator program. In this, we pick one person among the adolescent who work as a peer, and then he circulate the information of the government and other schemes to their peers in the adolescent. Then we have the Medical Termination of Pregnancy Act 2021. Actually, in this act, there some amendment was done. The requirement of opinion of one registered medical practitioner for termination of pregnancy up to 20 weeks of gestation, enhancing the upper gestation limit from 20 to 24 weeks for vulnerable group of women, non-applicability of the provision of 1 minute. For retaining to the length of the pregnancy, strengthening protection of privacy of a woman. So then we have a Preconception and Prenatal Diagnostic Act. It is in 1994. And then the most common program is National Tuberculosis Elimination Program, in which we are committed to this. In this, we have a decentralization of our TB services. We have availability of TB services for diagnostic and treatment. We have presumptive TB examination. We have active case finding and vulnerability mapping. And we have a status of Nikshay and Poshan kit. So now if we talk about today's topic, as we're talking about the research, as I already mentioned that yes, India is working very hard to curb all the public health issues, but still we have various challenges if we talk about the anemia, C-sections, and the using of IT platform and, keeping free India from TB. So in India, we have a ICMR, that is the Indian Council of Medical Research, who usually do all the research services for the government. And ICMR under the DHR, yani District Health Record, they are the government of India under the ambit of our Prime Minister Narendra Modi. They launched a policy on biomedical innovation and entrepreneurship for medical professionals. So in that, they give platform to all the doctors, nurses, and other medical professionals to come up with their key researches, and when it will be finalized and when it will pass by the ICMR, it will be published and they may set up their own unit also. The various areas are the human resources for health and medical education. We need to strengthen the medical education and we need to make it as a hub so that the medical colleges will act as a nodal centers in all the states where they percolate all the medical policies or healthcare services and governance to the district hospital and the community. We have a national digital health mission under which we are promoting the IT researches. We have foreign direct investment in which we promote the medical tourism. We have a health diplomacy, tax incentives, and then again there's a lifestyle disorders as India is now facing the dual burden of diseases. While communicable diseases still account for 33% and NCPs are 55%. So it is a big area for our research. India is currently around 60 million diabetic people. So yes, the currently researches are going on GDM and other NCD areas. And yes, we should not forget our aging population. Currently, we have the youngest population, but now we are moving towards the aging. So we need actually too much research on aging and its interlinkaging with the NCDs and how India, we need to know that how India will strengthen themselves in the public health for these aged population. Thank you.
Yeah, thank you, Dr. Bhumika Talwar. You have present such an interesting topics, yeah, especially the situation of health programs in your country. Yeah, okay. For the audiences would like to ask a question to the second speaker, you can raise your hand or you can write your question in the chat box.
Yeah, in fact, they can mail me any questions. I can give them and provide them the policy document also.
Yeah. Sorry, doctor, I cannot see your face.
Yeah, I think there is some technical
issue.
issue here.
Maybe,
Why you're not able to see my face? I am actually trying my level best, and my camera is actually on. So I don't know. So I'm really sorry for that, the camera issue.
Yeah, I think. Yeah,
now
I
you
can
can
see
see, I think.
clearly. Yeah, thank you.
Finally.
Yeah. Okay, I think there's one question from Pak Badar. Yeah, Pak Badar would like to ask a question. Pak Badar, maybe I can help you to translate if you want. Yeah, but if you want to.
Yes.
Yeah.
Thank you very much for the second question for me.
Bisa dibantu, Pak?
Good morning.
Oh, yeah.
Good morning, Dr. Bhumi. How can I?
Good morning.
How can I address you, madam?
You can address me, Bhumika.
Okay. Well, good morning, Dr. Bhumika. Yes. As I know that your country, India, is a higher population growth.
Yes.
Number 2 after China. Yes. So my question is how to manage family planning in your country. Thank you.
Yeah.
Yes.
Actually, that's what I'm saying. That you know, a few days back there was a international conference in Pattaya, and India was considered as one of the best countries for considering the family planning and the usage of the family planning. Yeah, we have actually in India we have a mixed population. We have Hindu, we have Muslim, and other communities also. So the point is, we actually strictly promote our basket of choice approaches. We have a RKSK counselor in all the hospitals. The aim of that counselor is to counsel the women and the male members about the basket of choice approaches, about the use of condoms. And in fact, for the adolescent people, we promote the use of condoms, that because we can't control them for the, we can't control them for their physiological processes. Like we can't send them that you don't do sex and all. But what we can ask them, use the protection, which is very, very important. So we promote condoms, we promote the our injectables. We have a DIMPA, and actually its coverage is very good in India. Then we have the vasectomies, and we have these laparotomy surgeries. And in fact, we provide the extensive trainings to our surgeons, and we deploy that surgeons to the entire hospital. And then we provide the camps also. And for the family planning, we have approached a Nai Pehel kit, as I told, that once the person get married, he went to particular village or particular area. That area NM gifted them a package in which they have a condom, the family planning contraceptive, along with the accessories of like lipstick, kajal, and other thing, so that she doesn't feel offended that directly we are providing them a family planning measure. So first we welcoming that lady, and then slowly we are training her about the the family planning methods, about when to give birth to a child, about her age, and when to give the spacing. So in this way we are moving ahead.
Yeah, thank you very much for your good answer.
Thank you.
Okay, the answer is clear, yeah, Pak Badar.
Yes.
Yeah.
Yes, I think so.
Yeah. Okay, maybe anyone who want to ask question to Dr. Bhumika Talwar. And then I have a question for you, Doctor. Maybe I'm still wondering. Oh yeah, one question from me. Yeah, I'm still wondering. Yeah, from me, I'm still wondering about how the contraception programs implemented in your country.
See, actually, family planning is a very, very, late program. Actually, it started very long back, and still we are struggling hard to, implement that. We try, we fail. But yes, I told you that we have a very, very stringent policies, and we have a very strength capacity. Actually, our main focus is the suppliers. We ensure that when we are saying that you need to use this, the supply should be available. We have installed condom boxes in every places that the person should go and pick that. So our promotion, IC strategies, and the capacity building is so strong that every person knew that we need to do that.
Yeah. Okay.
I personally feel that this is a behavior change, and it actually takes time. And India has also, crossed that line of behavior change. And we also say that now we are 8 billion people, and India is contributing in that also.
Yeah, I think
so we are really trying hard, and yes,
yeah, I think
we have the norm of 2-child norms, and very soon the government is saying a 1-child norm. So we are also moving into that.
Yeah, I think in Indonesia we almost we faced almost the same problem. I think, yeah, true. Okay, thank you, Doctor. Maybe the next question is from Mrs. Indah atau Bu Indah. Yeah, Bu Indah, you can ask a question to Dr. Bhumika.
Thank you, Dr. Bhumika. I'm glad to meet you. Thank you for joining the conference. Dr. Bhumika, this presentation, one slide, the National Quality Assurance Program in India. The last one, Suman, or right? Yeah, that's. Can you explain the Suman process as one national quality program, as one national quality services program in India? Thank you.
Okay. So if you give me 2 minutes, I have a detailed slides for Suman. So if you give me 2 minutes, I can go through so that you can understand the entire process, what actually Suman is, if you allow me. If time allows. Otherwise, I can explain you what verbally also, what you suggest. See, actually what Suman is, I'll tell you. So under Suman, we have divided our hospital into 3 packages. That is a basic package, BMOC package, and CMOC package. And in these packages, we divided our healthcare facilities. The basic package is a packages where we only provide the quality antenatal care services, screening. So under that, we have our PHCs, primary healthcare centers, and our sub centers or health and wellness centers. Then we divided our services to the BMOC, that is basic emergency obstetric care, where we are able to provide only normal vaginal births, where we don't have the C-section options, we don't have a gynecologist. We only have our midwives and nurses. So those facilities are our community healthcare centers or some delivery points in PHCs. Then we divided into our third category is comprehensive emergency obstetric care, that we have all the FRUs, first referral units, where we have a blood bank, where we have provide the C-sections, that comes under this category. And then under this, we are giving an assurance. We are writing that yes, if a patient went there and they doesn't find such services, we are displaying these services in our hospital under the ambit of a basic BMOC and CMOC. And if patient doesn't find these services, they can complain in a grievance portal. Then these grievances will be managed by the state government within 1 month. And if they won't able to manage that, it will percolate to the with the national government. So we are very stringent for that. And under Suman, we are also providing 1,000 rupees to the first responder who will first respond about the maternal deaths. So we are actually very much into reporting each and every maternal death under Suman. Once a maternal death happened in a village and you came to know, for example, you are an Asha or a village person or a neighbor, and you came to know that this death happened, then you have to report to 10, you have to call and you have to report to 104 that that death happened for an X person. Then the medical team went there, they do the verbal autopsy and see that that happened actually due to a maternal cause or a natural cause. If that cause, and it's confirmed that death caused due to a maternal, then you get the 1,000 rupees. So this is like to reporting and, motivating the community and making aware them that death is not a small event. So once the death happened, you have to report it. So under Suman, we are providing these services. And third is the respectful maternity care, which is very, very important, which is a similar concept in the midwifery also. And that we promote that there should not be no denial of services for the pregnant woman once she entered. And everybody has to follow the respectful care approach by providing the privacy, by speaking in a politely manner, and other, actually we have the entire SOPs and the detailed outlines in that way. So these are the basic crux of Suman. And secondly, I think you asked the National Quality Assurance Program, right? So under the National Quality Assurance Program, which we have a Kayakalp and NQAS, in that it is very similar to the NABH accreditation. I think you heard about the NABH accreditation for the private hospitals. Similarly, we in government, we are doing the NQAS and Kayakalp. In that, we have a specific checklist. If you want, I can provide you those checklists. So in that, the hospital first has to do the internal assessment. If they score above 80%, then the external assessor team will go and do the external assessment to them.
Yeah. Thank you.
Yeah. So in this way we work.
Yeah. Thank you, Dr. Bhumika.
Yeah.
Winda.
Dr. Bhumika, this packaging in this case, yeah, case in maternal and neonatal. Yeah. Thank you.
Thank you.
Thank you. And I'm sorry for other participants who would like to ask question to Dr. Bhumika because the time is almost out. Yeah. And we would like to close this session, but before that, I would like to give a short conclusion, yeah, about your presentation. So the comprehensive healthcare in India are consist of primary, secondary, and tertiary, and various health programs are available from the governments in India, such as ASHA Project, Free Drugs Initiative, Free Diagnosis Initiative, National Quality Assurance, and IT Initiative, and etc. And then the strategic intervention under RMNCH consists of nutrition, reproductive, maternal, and newborn child and adolescents. Yeah. Okay. Thank you, Dr. Bhumika. Yeah. We come.
Thank you.
Yeah, we come. Oh, sorry, I forget that. We would like to give you a virtual certificate from the committee in this conference. Yeah, thank you for your contribution as the speaker, the second speaker in this conference. Yeah, I hope that we
Thank you.
can. Yeah, I can meet you again. Maybe in the next
Yeah.
conference. Yeah, thank you.
Bye.
Yeah, bye.
Bye.
We come to the end of this session. Thank you very much, Professor Dr. Muhammad Nazil and Dr. Bhumika Talwar for joining with us. Health Polytechnic of East Kalimantan is really appreciated. For participants, thank you for being such wonderful participants during this session. Hopefully, I can meet you again soon, maybe in the next conference. Thank you very much.
Okay, thank you very much for the speakers and moderator, Mrs. Rizka Indah Mulyani, Master of Science. Okay, next.
Okay, now let's do the second moderator, Mr. Abdul Halik, Master of Education. Please welcome our moderator to Mr. Abdul Halik, Master of Education. Time is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much, Mr. Rian. The master ceremony of the second East Borneo International Conference 2022. Okay, so for this session, I would say welcome to the third session of this seminar. Then we are going to have the 3 sessions to go. That is the third session, the fourth session, and the fifth session. And I'm going to lead this session. Right. So let me introduce myself. My name is Abdul Holik. You can call me Pak Holik. And I'm going to be the moderator in this session. And then as a soft reminder that we are going to have the session divided into 3 main parts. Firstly, material presentation by the speaker. And then this one is going to take 30 minutes. And secondly, it's going to be the question and answer session. And then in this question and answer session, the audience who would like to ask, you have to state your name and state your name clearly and your institution. And then also comes to the third session, that will be conclusion. Right. So for this third session, we are going to welcome Mr. Professor John C. Gomez, MANRN, from Center Escolar University, Manila, Philippines. Hello, good morning, Mr. L. John C. Gomez.
Yes, good morning.
Okay.
And thank you for the invitation.
All right. It is very nice to have you in this seminar. And we are very glad to be with you to have this seminar. Okay, sir. Your theme today is going to be paving the way for health transformation, Smart Society 5.0 through research and innovation. Okay, then time is yours.
Okay, thank you for the introduction and for the warm welcome. I would like to greet the organizers of the conference and of course the administrators of the institution. So a pleasant morning to all. I am Professor Earl John C. Gomez, and I'm from the Philippines. Okay. So I am the assistant to the Dean of the School of Nursing of Central Escolar University, Manila, Philippines, and I'm also affiliated with Sigma Phi Gamma chapter as its finance director. So let me share with you my insights on the topic, paving the way for healthcare transformation, Smart Society 5.0 through research and innovation. And actually, this topic is very much timely because we are moving away from the pandemic, and there's a lot of things that we can do so that we can transform healthcare to something that is sustainable and something that can help our patients achieve a healthy life. So for my presentation outline, I will begin with the idea of a Smart Society 5.0 and health transformation towards smart society, some of its challenges, and of course, some research and innovation. And towards the end of my presentation, I am going to share with you some innovations from the Philippines, okay? Because I think most countries as well are moving towards this particular innovation, and we would want to share this to everyone. So let me share first this video about smart society.
The fourth industrial revolution will enable us to create a new society. Artificial intelligence will transform the big data collected through the Internet of Things into new wisdom. Society 5.0, a technology-based, human-centered society. The fourth industrial revolution will raise our standard of living and solve various challenges we face. It will, for example, free us from the stress of driving, allowing us to safely visit anyone, anytime. We will have access to the latest medical advancements at a low cost, no matter where we are. AI and robots will enhance human ability and expand our infinite possibilities, helping us enjoy more fulfilling lives. Society 5.0, for the betterment of human lives.
Okay. So what I would like to drive at this particular presentation or this particular video is the idea that the Society 5.0 is something that will create a better life for everyone. And for us in the healthcare industry, we are after improving the lives of our patients. We are after developing quality lives and better healthcare for them. And through our Society 5.0, we will be able to realize that particular dream or that particular plan. Also, I would like to bring into context the idea that in Society 5.0, we actually look into the utilization of our data. I think in our institutions, in the healthcare field, in the hospitals, and even in industries, we have a lot of data. And through this data, we will be able to transform our healthcare because through data, we will be able to build researches, we will be able to realize plans, and of course, implement strategies that can improve the society and the lives of everyone. So, what about the concept of smart society? So if we try to look at the definition of a smart society 5.0, we come to realize that it's a human-centered society that can balance both economic advancement and the resolution of social problems through a system that highly integrates cyberspace and physical space, and things such as this are now known as a society 5.0. Let me emphasize the idea of a human-centered society. So when we talk about smart society, it is a society that is driven by humans, by people. So we are in a better position to improve healthcare system. So we in the healthcare society are not actually at the mercy of internet, at the mercy of robots, but we are actually the one who should be driving infrastructures and technology so that it can bring improvement in the lives of our patients, of our stakeholders. And human intervention should actually be looking at alleviating patients' anxiety. It must be looking at improvement, and therefore the smart society should actually be looking at helping people. And that's why we are here for economic advancement and for the resolution of our social problems. So I hope that when we create our researches, when we create our innovations, our focus is on the improvement of our stakeholders. So in our practice, probably we have a lot of stakeholders in mind, and we have a lot of reasons why we pursue our research. But I hope that at the center of it is our patients. Okay, so we do this to help resolve problems and bring improvement to the lives of our patients. And smart society, the word smart actually focuses on the idea of utilizing our cyberspace and our physical things or our physical space. So we utilize our technology for the betterment of our patients. So this is a diagram of the current society and what Society 5.0 would want to achieve. So in our current society, for an instance, we are living in knowledge and information are not shared, and cross-sector value is difficult to create. So in the Internet of Things, we will connect all people, things, and sorts of knowledge and transform them into a new value. And I think what we are doing right now through this conference, I think we have speakers, we have invited participants all over the world. And this is a form of knowledge sharing. So in Smart Society 5.0, knowledge sharing is very much important because new knowledge should not be kept, should not just be set aside, but this must be shared. So if we are sharing information, hopefully this can spark new ideas for us to develop innovations and researches in healthcare. Another is that in the current society, there are a variety of constraints that exist with respect to social problems. But in Smart Society 5.0, social issues will be overcome and humans will be liberated. So one of the things that we are looking at in healthcare is the disparity in the delivery of care. So there are, for example, different standards across countries, but there's only one goal, that is to improve our patients' lives. So maybe in Smart Society 5.0, we will be able to overcome those disparities. And of course, we would want to promote the equality of healthcare across nations and societies. So in the current society, there's an overflow of information. The work of finding and analyzing the information desired can be difficult or too burdensome. For example, if we have a patient and our patient is generating data, okay, for a 24-hour period, we have our vital signs, our physical assessments, and those are too numerous to process for a single day. But if we have a AI, artificial intelligence, this can free us from the burdensome work of analyzing the huge amount of information. And in nursing, I think we have a course which is called informatics, nursing informatics. And I think that's also true with other allied medical sciences. We have informatics as a component of our course, and that can actually pave the way for the idea of artificial intelligence. So this AI will help us to predict, for example, future diseases or future complications that our patients will be encountering. Okay, so if we have this idea that our data can help our patients, then the more that we should pursue the conduct of research and innovation. And of course, people do a large amount of work, and we have abilities and limitations, and the behavior of the physically challenged is constrained. Okay, so the idea of a smart society does not just dwell on the idea of data and its utilization, but also on the creation of smart devices, smart robots, which can help us do our work. Okay, I think, for example, we have wearable devices such as smart watches that can gather your oxygen saturation, your pulse rate over a 24-hour period. And that actually generates data. So you don't need a separate device. You just need your smartwatch, and you can actually monitor how your pulse rate and oxygen saturation is developing. We also have our digital devices, for example, our blood pressure device, okay, our sphygmomanometer, which now can be worn over our arm, and that can measure blood pressures accurately as well. So if we have a smart society, we are just actually creating ways for our patients and for our society to improve our healthcare delivery. So this is, for example, the road to society 5.0. So you could see on the left side of the screen, we have the different areas of our society, from hunter-gathering society to agrarian to industrial to information. And now we are into moving towards Society 5.0. On the Society 4.0, we have realized that our cloud system, okay, I know that some of us are utilizing cloud to store documents, to store information, but this can also store healthcare data. And through cloud, we are able to access our data through different platforms or different access points. For example, you might have your computer at home and you also have your computer in the office. And if you store the data into the cloud system, whether you're at home or you're at the office, you can, you can access that data. And since we are knowledge sharing, okay, for example, you have a team of healthcare providers, you can do a knowledge sharing, and each of you can access that particular data. So you can discuss, you can improve, you can try to plan or implement something for your patient, and that data that is stored in the cloud could be utilized. So you could see that the physical space is not just limited into the hospitals, into our offices, but we can search through our cyberspace. But through Society 5.0, we have a bigger society called cyberspace. And here, we try to look at our big data. Big data is defined as data that is too numerous, okay? So for example, if you have 100 of patients and you would want to identify whether this particular intervention is effective, then you could do an analysis of your big data. And that big data can actually drive our artificial intelligence. So this can create us more convenience and of course, more improved services for our people. So here, we have to look at other ways where AI can help us. For example, there could be automatic driving. AI can, propose a certain type of intervention for our patients, and ultimately, it can produce automatic responses that can help us in our day-to-day activities. Okay. So how do we compare our Smart Society 5.0 from before? So before, you could see that we only have our buses, we only have our regular transportation, but in Smart Society 5.0, we could have, for example, our applications. So if you would want to go from one place to the other, you don't have to physically wait in the waiting shed, but you can actually use your smart devices. So if our patients would want to go to the hospitals, for example, to have their checkups, then we could have our device or application do that. Or if we try to look at the way we build things, okay, so we try to look at bridges, but now, for example, there are sensors, there are speed sensors that can warn you if you are overspeeding or if you are not following the traffic rules and regulations. And that brings us more safety, okay? So it will try to prevent accidents which are actually detrimental to our health. And the way we do our transactions, so before, if our patients would want to pay for their medicines, for their medications, they try to look at the idea of banks or ATMs. But now, they can do that in their mobile devices. And for example, in the Philippines, we can order medications, we can order devices through our smartphone applications. And that can actually revitalize our healthcare because you don't need to leave your home, especially during the time of the pandemic. You don't need to leave your houses to buy medications or to gain access to healthcare. You can actually do it via your application. And if you are looking at having consultations, for example, you don't need to go out because of the dangers of the virus transmission because of the pandemic. And you can simply have your internet, your computer, and you can have your medical checkup, okay, done over our connections. And that actually creates a better space for our patients because options are being provided to them. Of course, we can say that virtual checkups, virtual consultations might not that be as effective as a face-to-face one, but both has its pros and cons. I think what should be highlighted is the idea that we provide our patients, our stakeholders, with options. So if this particular option can fit them, then that's actually better because we try to prevent the spread of infection. So Smart Society 5.0 is human-centered and it provides us with choices for the way we do our things. So we have here a timeline of how Smart 5.0 is progressing. And you can see that at the fourth industrial revolution, we already have digital transformation. I think back when I was still a student, our seminars, our conferences are face-to-face in a large area, in a large venue. But look at what we are doing right now. We are sharing knowledge across countries, but it's done virtually. So it has transformed the way we do things. We have cyber, physical systems, we have artificial intelligence, we have Internet of Things, blockchain, and etc. And that's how Smart 5.0 are progressing. So how does it translate to challenges to our patients? Maybe we have to look at the digital health literacy of our people. Because while technology is progressing, we also have to consider the capabilities, the understanding of our stakeholders, especially of those who are in their advanced age, okay? Because they might not have the same vitality, the same patience to learn the new ways of doing things. So maybe a research on digital health literacy of our society can be done so that we can see whether our society actually is ready for a Smart Society 5.0. So what else? This is a very classic example of how Smart Society 5.0 is affecting healthcare. So before, if a patient would want to go to a healthcare provider, he has to physically travel. And of course, for people who are in their advanced age, this is quite a challenge. This is quite difficult, okay? But look at the idea of Smart Society. The services are integrated, okay? And of course, it's actually can be done remotely or virtually. So here is a research conducted about Smart Society. And of course, we have to realize that our Smart Society can bestow or can improve the quality of our lives. Okay? I think it's actually very much evident here. And deep learning with Internet of Things can effectively applied with the healthcare sector to automate the diagnosing and treatment process even in rural areas remotely. So our applications can include disease prevention, diagnosis, fitness, patient monitoring, food monitoring, and many other processes. So it depends upon what type of care are we looking at for our patients. But Smart Society, through our technology, can bring improvements in the lives of our patients. So let me show you this video of a Smart Society in healthcare.
In Japan, innovations in the field of life science have been transforming our society so that people can live longer, healthy lives. For example, big biometric data gathered continuously every day will alert users to an illness before there are any outward signs, enabling them to receive prompt medical treatment. With new medical and communication technology, patients will be able to consult with doctors anywhere, anytime. VR surgical simulators will enable more advanced examination and diagnosis. The knowledge and technology of myriad physicians will be compiled into a multidimensional, shareable database, improving medical technology as a whole to help eliminate the current disparity in the level of medical care among patients. Diagnostic imaging, which has become fast and accurate thanks to deep learning, is contributing to the early detection of diseases that have been difficult to diagnose. This will enable doctors to spend more time with their patients and reduce the physical and economic burden on patients. Japan aims at realizing Society 5.0, a technology-based, human-centered society.
So what can we derive from that particular video is the idea on how healthcare can be applied to our patients. And of course, while Japan is primarily moving towards that can be adopted across countries, and that can actually be that idea can actually be propagated so that we can also apply the concept of Smart 5.0 in our respective areas. So here is a diagram of how our Smart Society 5.0 can actually bring betterment to our patients. It can bring comfort. It can provide vitality. And of course, now that we are in the era where we are pursuing high quality of lives, we are able to utilize this process so that we can provide care and comfort to our patients in a variety of settings. So vitality, comfort, and high quality of lives are the products of Smart Society 5.0. So here are some ways where we can actually look at the Smart 5.0 in the area of healthcare. Of course, we have to critically think what type of care are we going to provide for our diverse set of patients, and we can actually utilize variety of technological innovations, whether it's sensors, manufacturing, scanning, telemedicine, or tissue engineering or biotechnology. Then we could actually provide platforms, systems, recorded patient data, processes, compilation, and monitoring. And this is actually very important for us because sometimes when we try to decide or to decipher what actions to take, I think we have to utilize our data as our primary source of information, and of course as our consideration for coming up with our respective decisions. So the Smart 5.0 is also reflective of our developmental goals. This is actually from the World Health Organization. And of course, with the many goals at our hands, the role of technology through innovation is very much important. And I think what we could do is to look at how we are able to apply technology in the care of our patients as we try to, for example, come up with the best decisions, best diagnosis, best course of action, or best plans to take. This is actually something that is relevant. And if we try to look at the idea of preventive healthcare, okay, so through our integration of technologies into our wearable devices, we will be able to predict or maybe analyze a particular situation that is developing. Of course, we have said that prevention is always better than cure. So if we have technology that can prevent and promote health, I think that is really laudable. So what is the challenge of...
the English thinker Malthus argued in his famous essay on the principle of population in 1798 that there was no longer sufficient land in the world to feed a rapidly growing world population, threatening poverty and famine. but an agro-industrial revolution soon transformed the economies of Europe and North America, and his fears proved unfounded. Over the past 10,000 years, the different agricultural and industrial revolutions have given us access to unimaginable levels of wealth and well-being. In the last 100 years alone, average life expectancy has more than doubled. GDP per capita has tripled. Infant mortality and food prices have decreased 10 times. Transportation costs have decreased 100 times, and the cost of communications has decreased 1,000 times. Since 1960, the integrated circuits are 30,000 times faster. Since 1975, the price of solar panels dropped 250 times, and since 2001, the DNA sequencing is 100,000 times cheaper. This was the journey towards the Industrial Revolution 4.0 that gave birth to smart factories through the use of cyber-physical systems. With IoT, big data, nanotechnology, robots, blockchain, drones, 3D printing, biotechnology, and AI as primary drivers that can also enable a social transformation in medical and healthcare, education, mobility and infrastructure, fintech, food and agriculture, energy and resources, environmental and climate changes.
So what the video would want to convey to us is that everything else is changing. So the way we view things, the way we view our society, the way we view our problems, the way we try to innovate for our patients and do our research are changing. And of course, when you try to look at these changes, you would want to look at the future of healthcare. So what is the future of healthcare in the coming days?
In the decades ahead, healthcare will undergo dramatic transformations. Medicine will become more precise. Value will shape care delivery. Patients will become empowered consumers. And digitalization will transform every facet of healthcare. Patients will have a digital twin, a customized computational model of themselves, enabling Dr. Clive to anticipate illness, guide therapy options, and predict outcomes of procedures. Expanding precision medicine will enable radiologists to make highly specific diagnoses for Stephen without unwarranted variations. AI-powered decision models, fed by vast population health data, will improve diagnostic accuracy. Healthcare will become anticipatory, organized around Paula's medical conditions, and available around the clock, transforming care delivery. Multidisciplinary, highly productive care teams structured around patients and their needs will collaboratively deliver the full cycle of care. All interactions with John will become convenient, personalized, and compassionate, improving patient experience. Supported by real-time monitoring and guidance, John will become more empowered and have physical and virtual access to care when and where he needs it.
So imagine if that is the future of our healthcare. Of course, we can say that that's better, that's essential, but of course, we have to look at our needs, and we have to look at our resources. Do we have such resources to carry out such plan? I think that's actually a great challenge. Let's try to get a glimpse of what a smart hospital is in the future.
Healthcare facilities are continually evolving to better serve the needs of patients, doctors, and staff. To meet regulatory compliance for patient satisfaction, operational efficiency, and clinical process of care, a modern hospital must leverage smart technologies throughout the facility. Hospital administrators, IT and facility managers are specifically tasked with the challenge of providing safe and secure settings, network connectivity, critical power, improved communication, and ultimately interoperability of this infrastructure.
So these are the things that is needed if we would want to create the concept of a smart healthcare facility. And I think for those who are in the administrative positions in their particular institutions, this is critical because if we would want a smart facility, a smart institution, our resources should be supportive of such. That means that we have the settings, we have the connectivity, the power, the communication, and of course, our infrastructure intraoperability. So let's try to look at the elements from the European Commission in 2022. How does the research and innovation is applied? First, we have to adopt a human-centric approach. At the center of technology are humans, so we are the drivers of change. We have to upskill and to reskill our workers, particularly those that are digital. As I said, we can actually come up with a research on digital health literacy and see whether our people, our persons, or our stakeholders are ready for the smart society. Modern, resource efficient, and sustainable industries and transition to a circular economy is needed so that we will have the resources to carry out our plans. And of course, a globally competitive and world-leading industry can speed up the investment in research and innovation. So according to Maria Gabriel, the new concept of Industry 5.0 could not come at a better time. Many industries are reinventing themselves. We have to reinvent, and we have to adapt to the new COVID-19 reality. Increasingly embracing digital and green technologies must be there to remain the solution provider for all our stakeholders. Now is the time to make our workplaces more inclusive. Children idea is that technology must become the accelerator and enabler of change and innovation, and digitalization provides industry with unprecedented opportunities. I think we have cited a lot of possible benefits of utilizing digitalization, but through digital technologies, we are able to come up with radical workplace innovation. So our workplace is not just on a human-centric way. Our Industry 5.0 can support and empower. Remember that we don't want to replace our workers. We would just want to empower them with better opportunities and with better way of doing things. So we have to green our economy, okay, so that they will be able to have a strong background. And of course, we should transform our industry. Okay, especially for our industry workers, the role of technology has changed the way we do things, and therefore, new skills are needed. So when we talk about research and innovation, I think we should also look into the way that we apply, the way that we carry out our functions through our new things. So let's try to look at our innovations. We have our for example, new micro machine ultrasound transducers. Okay? So if we would want to better check on our patients, we could have this device. And of course, in terms of cancer, we also have the particle beam therapy. Okay? This is a new way of providing radiotherapy to cancer patients. We have we have our healthcare informatics technologies, okay, wherein we can have our smart cyber operating theaters. So what about in the Philippines? What we do? We have transforming urban areas into smart cities. Okay, so we are trying to look at an integrated, holistic approach to city projects, wherein we can improve the lives of our patients, the lives of our citizens. And there's also AI in healthcare. So medical sciences have been using AI extensively. And of course, it can include diagnosing our patients, drug discovery and development, improving communication, patient interaction, transcribing medical records, and the rest. So it depends upon what type of processes we would want to digitalize. But I hope that when we carry out or when we decide, we take into consideration our patients as the primary beneficiaries of our actions. So we also have the smart cities. Okay, for example, we have smart LISA, smart traffic lights system with analytics that can improve or prevent accidents. We have TANOD, traffic analysis, intelligent urban surveillance systems, and smart MAIA, monitoring of air quality using Internet of Things and analytics. And these are projects, these are creations, research that can improve the lives of our patients. So this is something that is essential if we would want to grow from Smart 4.0 to Smart 5.0. So in summary, I would like to drive that Smart 5.0 is human-centric. We have the drivers, okay, the innovators, the researchers, and these are all humans. These are all people that can improve the lives of our patients, our stakeholders. And it must be resilient. It must withstand challenges. It must withstand time, and of course, the resources needed. And of course, it must be sustainable. So when we design our innovations, it must be something that can be sustained over time. Because of course, new technologies requires resources. And these are something that we have to think of. And at the center of it is our Industry 5.0, which is actually smart. Okay? So I hope that when we carry out researches, we must be looking at our patients as the stakeholders and how we can encourage them to utilize technologies. And at the end of it, it must be sustainable. That means it can be applied. It is not that complicated. It is not that expensive, but something that can be considered for their betterment. Okay. So I think that ends my presentation. Okay. So I would like to thank everyone for listening. And just in case if you have any questions, you can reach me via my email address. It's ecgomez@cu.edu.ph.
Thank you very much, Mr. Professor Erjon C. Gomez. It's a very interesting presentation, and you have already explained about the Smart Society 5.0. It is coming to the question and answer session. But before having these question and answer sessions, I think let me just make some points on your presentation, which is about the Smart Society 5.0. This one has a purpose to create new technology. This technology based on human-centered society to developing healthcare. And then point number 2 that you have already discussed here, that is about the digital technology, and this technical equipment can reduce workload and increase effectiveness and efficiency in healthcare, because the using of machine and internet in the framework of innovation is very important factor. And then the third one that you have already discussed here, that innovations means to have a new smart healthcare facilities. And also the industry of 5.0, it must be human-centered, and then also it must be resilient, and also it must be sustainable. Okay, great. It is very interesting. Okay, I think the audience then you can ask a question. Please raise your hand, and or you can write in the chat box, and we are going to read it for you. And before you ask the question, be sure that you identify yourself, your name and institution. Please, time for the audience to ask question to Professor Eljon. He is waiting for the questions because Mr. Eljon is sharing knowledge. Yeah. Okay. Please. You can raise your hand.
I think someone raised her hand.
Yeah, okay.
Yeah.
Hello? Yeah, thanks for the chance.
Okay, please.
Hello, Professor.
Yes.
Yeah. Good morning.
Morning.
I am. Yeah. Let me introduce myself. I am Mr. Amiruddin from Health Polytechnic of Kalimantan. Prof, yeah, I have a questions.
Sure, go ahead.
About digital skill. Yeah, could you tell us, what do you think, policy, government policy, in your country? I mean that in Philippines. Yeah. I mean that, how about, government policy to make society in Philippines familiar with the digital technology. Yeah, could you tell us about policy, government's policy? Okay, thank you, Prof.
Okay, thank you for that question. So in terms of digital policy, I think that's embedded in the education. I think in the way that we educate children as early as possible, we try to cascade to them the importance of utilizing digital technology. I think we have a subject as in elementary and in high school about computers, the way that internets are supposed to be explored. And in tertiary educations, we have informatics as a source for digital health literacy. And I think one of the latest policies on digital skills is about data privacy. Because of course, one of the things that is becoming more and more common is the exploitation of data. And of course, that can produce dissatisfaction and damage to our people. So I think the Congress of the Philippines actually passed a law on data privacy. So you cannot simply disclose information concerning people, especially, for example, healthcare records. These are very sensitive records that should not be shared with anyone else. And of course, we have to maintain the privacy of our patients. So right now, we are very particular, especially in the healthcare field, about maintaining data privacy and confidentiality of our patients. So we have that recent policy. But to increase the knowledge of our people in digital health, I think we have it embedded in our curriculum from elementary to high school. So we actually encourage them to utilize technologies, computers in the way of doing things. And I think most of our, uh, should we say, young populations are digitally and technologically skilled. But since this is rapidly evolving, I think healthcare providers should look forward to including and of course in making sure that persons with on advanced ages actually also become digitally literate, because I think that's something that is should be worked upon, especially for our clients who are in their gerontology years. We have to also include them in the process. So I hope I answered the question. Thank you so much, sir, for that.
Thank you very much, Professor. Pak Amir, Mr. Amir, what do you think of Professor's answer just now about the government of Philippines policy that actually the government encourage the people to utilize the technology, yeah? But concerning with the personal data, this is the personal right, so it cannot be exposed to anyone. Okay,
Yes.
thank you very much. What do you think, Mr. Amir? Maybe you have other maybe question? All right. I would like to invite other audience to give a question to Professor Eljon. One more question. Okay, there is a question, please.
Yes, I think someone raised her hand.
Okay.
Assalamualaikum warahmatullahi wabarakatuh.
Yes, good morning.
Yes, good morning, Mr. Professor. Thank you, Professor. I'm very interested in your explanation. I wish we can do it in Indonesia too, the technology. Based on the explanation in the slide, if I'm not misunderstanding, you explained that the application digital technology can reach all regions. But as we know that Indonesia, we have many islands and limited internet network. So what do you think about this problem? Maybe you can give us an idea or something to get the problem solving about this. Thank you.
Excuse me, Miss.
Okay,
Excuse me.
I think the
can you
number
explain
of
your name?
islands in both of our countries are actually the same. I think we also have a lot of islands in the Philippines. But as what we have presented, the idea of smart city 5.0 is that it is actually connected, and therefore the idea of improving our resources actually is a crucial step. So we really have to make sure that connectivity is empowered and that the people are connected. But on top of that, we can actually explore things like, for example, having our technology in with minimal data requirement. I think our IT support system can look at that so that when we access things, it will be minimally it will require minimal data connectivity. So I think that's something that can be explored. But of course, high fidelity applications will really require stronger internet connection. So I think what we can do is maybe look at it at a baby steps. We try to improve little by little our infrastructure, our connectivity, and through that process, we will be able to advance our idea of a smart 5.0. So we have to really look at better way of improving our resources and our structures or infrastructures so that uh, we can harness the benefits of technology. And I think in some areas we can do a study on how we can adopt the technology in that particular area. So normally, if we are rolling out something like innovation for our people, we can do a pilot test. Okay, so to see what can we do to address the challenges at hand. So I think that's a good way of doing things. So I hope I am able to answer your inquiry, ma'am.
Okay, right. So it has been answered by Professor about the the islands of Indonesia here has many islands. Then we have not many facilities about this one. So Professor Eljon advised to improve the number one, that is about the human resources, and then also about the facilities of the infrastructure. It is a process. Okay, right. Thank you very much. Yeah. I think it's come to the ends of our discussion in this seminar. Thank you very much, Mr. Professor Eljon. But before closing this seminar for the third session, we would like to give you the virtual certificate for you, Mr. Professor Eljon, as your participants and as your sharing knowledge to us for this seminar. Okay, that is the virtual certificate for Mr. Professor Eljon. Thank you very much, Mr. Professor Eljon, and we are going to see you again maybe in the next international conference. Thank you very much.
Thank you so much for the invitation, and I really appreciate joining you in this conference.
Okay, thank you. See you. Thank you very much. Okay, back to the seminar. Then it's going to be the fourth speaker, and then for the fourth speaker, then we would like to invite. We would like and welcome Dr. Dwi Prihatin Era, Escape MCAP, and she is from Health Polytechnic of East Kalimantan. Hello. Good afternoon, Miss Era. How are you this afternoon? Can you hear my voice? Okay.
Okay, I can hear you loud and clear, Pak Abdul Khalik, but they just unmute me, so now I can speak.
All right. Thank you. Thank you very much, Miss Dwi Prihatin Era. So
You can call me Era.
Okay, Miss Era. Okay, Miss Era. then Miss Era is from Indonesia, right? In this conference, Miss Era is going to present a presentation on research and innovation. Research and innovation, how it helps us embracing smart patient society. Okay, I think time is yours, Miss Era.
Thank you very much, Pak Holik, for the time. Assalamualaikum warahmatullahi wabarakatuh. Good day, ladies and gentlemen. Please let me introduce myself. My name is Dwi Prihatin Era, but my friends mostly call me Era. Okay. In this good opportunity, they gave me a chance to share my thoughts about research and innovation. And the question is how it helped us embracing smart or patient society. The three speakers before me already shared their thoughts about this smart society. So, as a forward, I would like to remind all of us about the patriarchy in healthcare. Long ago, and before the modern in medicine or in nursing, or even after the modern medicine, we know something about patriarchy in healthcare. The patriarchy in healthcare is the situation where patients often in unequitable patients provider dynamics, or they are in different level or in different position, which the center is not in patient autonomy, but rather in the powerful position of care provider. Maybe all my colleagues here in a virtual room know something about this patriarchy. Yeah, sometimes maybe we can still see how imbalanced there is the position between the healthcare workers and the patients. In this situation, the patient always had to accept suggestion or order from doctor or nurse without even they have the chance to make their self heard. Sometimes they cannot even speak about the symptoms that they had. And the decision is taken absolute. That is the patriarchy in healthcare. So after that, there came wake up call. The things change. The patient had access to healthcare more wide. And then there should be the care coordination interprofessional between the doctor and the nurse and the nutritionist, maybe the doctor and midwives, and so on. And also there is patient technology adoption. We know that the adoption of technology is widely used in healthcare for patients, both in hospitals and in community settings all over the world. We could see that how technology could help some of the patients in living with their disease. And then a new approach came. Yeah, we were introduced to the term of patient-centered care. Here in patient-centered care, the situation is different from patriarchy in healthcare. Here, most providers, policymakers, and researchers agree that patient-centered care represent a shift. So the change from traditional paternalistic, provider-driven, and disease-focused approach to the new approach that the patient is heard. Yeah, the patient perceptions, their needs, their experiences, taking into account atau diperhitungkan, dipertimbangkan. And into a free phase of health consultation. So the healthcare worker using the opinion, using the symptoms, the complaint of patient into the medical treatment. It makes this the patient decision is heard. Mead and Bauer said that patient-centered care encompassing 5 conceptual dimensions, that is the biopsychosocial perspective, patient as person, sharing power and responsibility, therapeutic alliance, and doctor as person. Here, in patient-centered care, doctors and healthcare workers no longer viewed as gods. Yeah, they just human, but with different roles, but in same position with patient. So that here, patient can have discussion. Patient can ask questions. Patient can make the best decision for themselves. Okay, next slide, please. So, in having that patient-centered care, how do we make that kind of ideal service a reality? We would like to apply them in real work. Yeah, not only di atas kertas, but it in the real care to the patient. So we must engage in a new approach, in new paradigm that is called empowering. Yeah, empowering, according to WHO, is a process through which the people or the patient gain power, gain control over the decision and action for their own health, state of health. Yeah? And this slide show us some of the research, how some of the research results, yeah, in helping or in changing how a nurse could change and empowering patients. Research by Crine at 2017 led us to implement a precautionary protocol for those with urinary catheter in the home care setting. There are lots of patients who live with a urinary catheter, and as we know that the urinary catheter needs to be evaluated every 7 to 14 days. Yeah? And the research by Crane revealed how caregivers and families play a role in maintaining the quality of life of their loved ones in order to remain well by preventing CAUTI. CAUTI is catheter associated urinary tract infection atau ISK yang disebabkan oleh pemasangan kateter. So research by Crane try to help us that family and caregiver could be empowered, dapat diberdayakan to prevent the CAUTI. And this is very important because CAUTI or catheter-associated urinary tract infection is a very dangerous condition in which could lead a patient to death because of the infections. Another example is the research by Carr in 1999, although this is a little bit older research, but it's still valuable. It is said that women and mother have demonstrated bold leadership under extreme adversity. Ya, mereka menunjukkan bahwa wanita, perempuan dan ibu itu dapat menjadi atau dapat memerankan peran kepemimpinan yang sangat hebat, and consequently, women and mother, when they are empowered, they could be effective partners in health promotion programs. That's why healthcare workers around the globe love to work with women and mother, because women and mother, they have powerful impact to the family member. Yeah. And the third example is research by Clemens in 2022. Yeah, he tried to tell us that intervention targeting caregiver depression and family functioning could be effective. This research is in a patient with heart failure, where the caregiver sometimes having depression because it is very hard in taking care of family member with heart failure. Yeah, Clemens tried to tell us that by targeting caregiver, by empowering caregiver, they could lead to increasing the quality of life, not only the caregiver but also to the patient. Yeah, these three researches try to tell us that empowering a patient, including their caregiver and family, is very important. Next slide, please. Here, this is the example how research and innovation taking role is in patients with chronic diseases. Lots of people living with chronic diseases, and they often live with limited conditions. Talking about limited condition is people who are living with the limitation that maybe they need assistance. Yeah? They need maybe they're using wheelchair, or maybe they wearing urinary catheter, or they're restraints in their beds. Yeah, and here the use of gadgets and applications is really helps. Application is scattered all in the internet. You could open the app store, and you could just type the keywords, and boom, you can find lots of application that helps a patient, help a caregiver, helps the healthcare workers, helps the nurse, and the list go on. For example, I just give you 4 application: Zen Onco Cancer, My Cancer Tracker, Sexual Disease and Infection, and Heart Disease Support. These are just the example of application can be used by caregiver or by the patient themselves. Yeah, and by using this gadget and application, who is the result of the technology, people or patient could self-advocate. People or patient or family, they get support from the group of people who have the same problem with them. Yeah, and also they could have real-time discussions and consultations with the real doctor who is verified by the application. So we could say that the innovation in healthcare management is important, and it could help us in doing in implementing nursing care. Next slide. Okay, here is the example that in breast cancer survivor care, they always focus on the area of recurrence or secondary cancer prediction. They focus on clinical decision support. The care is focused on cancer survivability prediction and go on. And applying research results and innovation to cancer survivor actually has shown some positive outcomes, including increased motivation of patient-reported outcomes. Yeah, by nursing using the application or innovation or the research results, they could help patient in having support. Yeah, in having answer when they got the symptoms and so on. Yeah, and it also help reduce the symptoms they always having, such as fatigue and pain, because as we know, patient with cancer is always having fatigue and pain. By using research results and innovation, it could help them. It helps them in alleviate fatigue and pain by doing some activities that is taught by a nurse or by doctor, and it could lead them to improve the improvement of quality of life and also the physical function. Now, the successful implementation of research and innovation include programs to promote and protect. This is the examples, yeah, to promote and protect breastfeeding in vulnerable infants, assist the elderly to remain in their homes. Yeah, they still in their homes, but the nursing care come to their house. Thanks to the innovation, yeah, and then thanks to the telehealth or telemedicine or telenursing. Yeah, by using technology, we could deliver the care. We could deliver the care to the people who cannot move easily. Ya, untuk mereka yang tidak dapat bergerak bebas, we using telehealth. Yeah, and then research and innovation also improve caregiver skills. Yeah, later on the next slides, I could show you some of the photos how caregiver skills could increase by using the technology. And then also research and innovation could provide affordable and culturally sensitive community and family healthcare services and strengthen the parenting skills thanks to health technologies. Next slide, please. Okay. To produce the capable nurse in implementing research and innovation, where we should start. Yeah, the registered nurse or nurse, di Indonesia disebut nurse, we must develop expertise to use data. Yeah, and then nursing education models must be adapted to prepare nurses. Ya, jadi harus ada perubahan di dalam sistem pendidikan, ya, yang menghasilkan a professional nurse. Yeah, because they have new roles, yeah, concerning the implementation of research results and technologies. Yeah, and then numerous policy and regulatory changes will be necessary as they add. And the quality of a nurse can be seen in terms of providing professional nursing care. Here are some picture or some photos, yeah, about how we educate the future nurse, yeah, by doing some practical or playing roles, yeah, in taking care of patients. Yeah, this quality can only be achieved starting from the process of molding nurse, mencetak perawat who has more professional knowledge, skills, and attitude through educational system. The three speakers before me already said about how we should balancing, taking the real focus on how to balance between the technologies and humanity. And I agree with that because sometimes the technology or the AI, artificial intelligence, it could change how nurse delivering their care. Yeah. We used to know that delivering nursing care atau melakukan pelayanan keperawatan is by doing face-to-face. Yeah, but now by using technology, we already have telehealth. It means that we don't have to be in the same place, not in the same room with the patients. It is great, because it helps us in reducing the time to go to the patient's place, or the patient need to go to the hospital. Yeah, but it also has the weakness that we don't do it in face-to-face with patients. Of course, this is reducing the real touch of nursing itself, because nursing is a profession that has the essence of humanity. We have the emotions that we embed in our work with our patients, with the caregiver, with the family. So we have to carefully in implementing technology. Don't make it ruined, don't make it mengurangi the essence of humanity yang menjadi the heart of nursing itself. Next slide, please. Nurses are required to appear professional when providing nursing care and able to collaborate interprofession, so that the services provided are carried out to meet basic needs, the basic needs of our patients. And the basic needs that we are talking about is not only biological needs, but also psychological needs and social needs and also spiritual needs. By doing ritual or daily activities of nursing, maybe taking the vital signs every day, or giving medication, by doing it, we could also show them the compassion of a nurse. We could show them the politeness, the decency, the courtesy of the nurse itself. And this picture shows us how a nurse helps patient in fulfilling their needs in spiritual aspect of the person. We see here that technology is facilitated by producing clean dust atau debu suci, for tayammum in Islamic manner. Sometimes that the patients cannot touch the water, or their condition is making them impossible to having wudu or ablution. So in Islamic manner, they are allowed to have the ablution using clean dust. Clean dust is produced by technology, of course, but the technology cannot replace cannot replace how this nurse, this male nurse, accompanying the patient in fulfilling their spiritual needs. I hope you understand what I say. Okay, next slide, please. And how should we respond the needs, of empowering patient and family and also community to produce the smart society? So we, as a care provider, we interacting and transacting with patient, families, and the health team member. So we taking the role as communicator. And we also, we then providing health education and promotion for patients, families, and communities. And we act as educator. We act as health promoter. And we practicing room management in hospital setting and community. We act as manager. And then we act as researcher. So these are the response on how we could produce smart society. Yeah, we using technology, but we also present, hadir bersama patients and their family, and the caregiver. Yeah, we present by their side, to educate them. This picture shows how a nurse educate a community, in their home. Yeah, of course, as we know that cadre or cadre, is empowered part of community that could help us to share the information, to strengthen the community, to produce the smart society. Also, we could see the picture of how the nurse, they train a community, they train people, how to do the basic life support. And this is how they perform a blood sugar check, uric acid, and cholesterol to the community. So they come from the community and they give something to the community, and it performed the activity of education and also discussion. No wonder that nurses are smart people who educate community to produce smart society. Yeah, I'm proud to be a nurse. Next slide, please. Here, also some picture on how actively nurses, in educate community by using the research results and also innovation. We using the innovation of the media in teaching about the life or the healthcare, that can be doing by the community themselves. This is the active involvement of nurses, to increase the health of the community. Next slide, please. And at the end of my slide, I want to conclude that nurses are able to expand its caring with the help to use exposure of a technology that increasingly being used in health sector. And nurse can implement innovation in each phase of the nursing process, whether it is in pengkajian, penegakan diagnosa, assessment, kemudian ada diagnosis, and so on until the evaluation. We must admit that digital technology and health-related application can help reduce the nurses' workload, that can increase effectiveness and efficiency in the profession. Yeah, because the combination of the technology and the internet itself is a very important factor. We cannot erase their roles, yeah, in health sector, but still the human factor become the equalizer, yeah, that make nursing retain its humanity essence in caring people. And that's how we could produce the smart patient and smart society. I think that's all from me. Thank you. Saya kembalikan ke Pak Abdul Holik.
Right, thank you very much. It was very incredible, yeah, and very interesting. And also the material was about the nursings. Okay, it's coming to the question and answer session. Then before having this question and answer session, I would like to say some main issues that has been discussed just now has been presented by Miss Era. Number one, the main issues that is about the patients. The patient that always had to accept suggestion and order from doctors or nurse without even had the chance to questions or even to be heard. So decision taken by this health provider taken was absolute. And then number two, then there came wake up call that patient access to health care, and then care coordination and patient technology adoption. So we are using the technology. And then the third main issues that is about the patient with chronic diseases often live with limited condition, and then that require them to comply with established regimes. And then assisting them in integrating all orders and suggestions from nurses can be facilitated by research based on innovation. And then maybe we have already got the information about the use of gadget and application, for example. And number four, that is about nursing as the profession that equalize to technology and humanity. And number five, we have to educate nurse through the system that mold them to become professional nurse. Okay, I think it's come to the question and answer session, but when you ask a question, be sure that you identify yourself and then your institution. Okay, you may ask the question by raising your hand or write on the chat box. Okay, audience, please.
We have one question that Pak Abdul Holik.
Yep, please.
We have question. One person is raised her
Mr.
hand.
Abnolik. Hello, Mr. Khalid.
Yes, please. Say your question, state your question, please.
Yes. Okay, thank you, Mr. Khalid. Hello, Mrs. Era.
Hello,
Good research.
Bu Grace. Thank you very much.
I'm is question digital technology and health related atau bahasa aja ya.
Boleh, silakan Bu Grace.
Teknologi digital ini membantu mengurangi beban kerja perawat. Tapi bagaimana kita bicara tentang faktor kemanusiaannya? Apakah cuma dengan digital itu kita sudah bisa membayangkan, kan biasanya dengan kita melihat berarti kita juga tahu bahwa sebagai seorang perawat bisa muncul. Nah, itu yang akan saya tanya. Bagaimana kemanusiaan itu kita pertahankan sesuai dengan hasil penelitian Anda? Apakah dengan penyakit lain atau seperti apa? Apalagi dengan penyakit jantung yang begitu butuh untuk pertolongan cepat. Terima kasih banyak. God bless.
Okay, thank you very much. So, Miss Grace asked a question about the actually about the technology that used for helping to the nurse profession here, and then how about the what we call the humanity factors that may be the side effect for this. All right, Miss Era, time is yours.
Okay. Thank you, Pak Holik. And hi, Bu Grace. Thank you for the question. You asked how digital technology could be implemented, and how about the weakness of the implementation itself. You talk about the humanity. As I mentioned before in my speech before, that digital technology it could strengthen or memperkuat. Yeah, they could strengthen the work of nurses. It could facilitate, memfasilitasi, but it cannot replace the emotions that we could deliver to our patients. We know that nursing itself is it comes from the theory, from the body of knowledge that emphasize and how we view human, yeah, as the very important aspect, yeah, to be the subject of our caring. Jadi manusia itu adalah subjek dari bukan objek tapi subjek dari caringnya perawat. So we cannot replace that emotions, that humanity, yeah, with technology. Maybe they could help us. For example, the video or technology could help us in talking in real time with people who is 1,000 miles away from us, yeah, by using like what we did right now, using a virtual room or Zoom, in FaceTime, yeah, using atau Skype, yeah. It could also help a patient to having consultation or discussion with their doctor or with their nurse. But still, it cannot replace how the presence of the caring one, bagaimana kehadiran orang yang peduli, ya, and the side of the patient, it's very touching, ya, sangat menyentuh, ya. Patient themselves, yeah, they could have they could feel that they got the support emotionally, psychologically, yeah, by the presence of the caring one, dengan kehadiran orang yang merawat mereka. By the presence of nurse, they could have the support, yeah, to their emotion, to their psychological. And even the presence of their family socially could help them feel support. So my suggestion is that we as the healthcare workers have to filter, yeah, menyaring what kind of intervention that we could use technology in it, but still we have to presence in the side of our patients and their caregivers or their family in the form as the form of support to their condition. I think that's my answer. I hope it can answer your question, Bu Grace.
Ibu Grace, what do you think?
I think she has a disconnection.
All right, okay. Miss Grace is not in online. Okay, right. So I think I continue to the next questions. Maybe if the other audience have some question, please you can raise your hand and please ask the question.
Maybe my materials is too clear so that the audience has no questions, no more, Pak Abdul.
Okay, right. So it means that it is really understandable, and the audience understood this material very well, since the language also very understandable, and you also present it very, slowly. Okay. Right, thank you very much. It's very interesting, and when there is no more questions, then we would like to give you a virtual certificate. Yeah, we would like to give you a virtual certificate as the speaker in this international conference. So this is the certificate.
Thank you very much, all the committee that invite me once again as the speaker. Terima kasih ya.
Thank you very much, and we would like to see you again for the next, maybe next international conference. Thank you very much. Okay, it's come to the fifth session, and then in this fifth session, we would like to welcome and invite Dr. Noor Baizura, MD Yusuf from Malaysia. Hello, Miss Dr. Noor Baizura. How are you this afternoon?
I'm fine, thank you.
Okay, all right then. I think that I would like to read a little bit about your CV. Allow me to read your CV. Miss Dr. Noor Benzima is a senior lecturer and a clinical dietitian at the Department of Dietetics, Faculty of Medicine and Health Sciences. And then she's also currently a member of the Malaysian Dietetic Association, a life member of Nutrition Society of Malaysia, and also assistant honorary treasurer for Malaysia Society of Body Composition. And then also she has more than 10 years of experience in teaching. Wow. You have experience, lots of experience, yeah, in teaching, and not only teaching, but also research in clinical community services, and also she has taught several courses related to research, and then she has also published in peer-reviewed journals and conference proceedings, and reviewed for national and international academic journals in the areas of nutrition, dietetics, and clinical research. Okay, very interesting. Okay, so I think that we invite our audience. Let's welcome Dr. Noor Baizura. Time is yours.
Thank you so much. Let me share my slide first. Okay, Assalamualaikum and good afternoon. Okay, before I start my presentation today, I would like to say thank you to all the organizing committee for inviting me to this prestige conference. Happy to be here. Okay, so my topic today, I will share with you the improvement of quality nutrition services to increase the growth and development of minority children. So the way how I look at this topic may be a little bit different, okay, but I'm trying to, in certain places, I will try to put in some of the technology improvement in order to tackle malnourished among children. Okay, so for today, okay, okay. For today, I will share a little bit on the prevalence of malnutrition, specifically for children less than 5 years old. And then we'll look at the health impacts, especially the triple burden of malnutrition. And then I go for the initiative, improvement nutritional status of malnourished children. That be scope, what are the framework that are provided from WHO, from UNICEF, in order to tackle malnourished children. And then we go to the fourth one, more on our topic today, equality nutrition services, and I'm trying to share what are the national plan of action for Malaysia for the year 2016 and 2025, and then somehow a little bit include the primary and tertiary care. So, first, please we look at the prevalence of malnourished children worldwide. Okay, so before that, just to recall back, actually, there are two pathways that leads to the three issues now here. Children stunting and wasting, micronutrient deficiency, overweight, and obesity. So we look at this graphic. Actually, it tells us actually there are two different ways. There are the nutrition pathway that leads to inadequate infant and child feeding, because of the less of food consumption. And it leads to insufficient intake of calorie, protein, vitamin, and mineral. And then, of course, it leads to the child stunting or wasting. And then somehow another way around, actually, another way, actually look at the anxiety, stress, depression, and then how it leads come together with the disordered patterns of eating, and then it leads to the less of increased food consumption, and it's linked together with the inexpensive, high calorie, low nutrition foods, and then metabolic adaptations of food deprivation that leads to the obesity. So one of the important that data can provided by UNICEF, WHO, and the World Bank together. This one I focus on the 2021 editions, which is more on the predicting child obesity, predicting the malnourished children. But somehow it's good for us to look at the trend of the malnutrition among children. So level and trend in children malnutrition. So when you look at the overweight is still increased. It's about 5.7% of 38.9 million children under 5 years under 5 years old. And then when you look at the stunting, okay, is higher. Okay, it's about 22% of 149.2 million children under 5 years old. And same goes to wasting. Okay, so we know that starting never attain their full possible height, and their brains may never develop to their full cognitive potentials, and therefore they may get disadvantage in terms of learning difficulties in school, leading to the cognitive capability, earn less as adult, and face barriers to participate in their community. And then wasting, we know that actually it's come from the life-threatening result of poor nutrient intake or disease. And then this is linked with the weakened immunity and susceptible to long-term developmental delay and face increase of death. Somehow, this condition may be more worsened during the COVID-19 pandemic, and now it's pandemic, because of due to the deteriorations in household wealth and disruptions to the ability and affordability of nutritious food and essential nutrition services. So childhood overweight, right? Children, due to the children intake from food and calorie from food and beverages exceed their energy requirements, and therefore it increases risk of obesity, diet-related non-communicable disease later in life. And then this is during the COVID, we know that most of the fresh nutritious food has been replaced by processed and healthy food, and where movement restriction it leads to the constrained opportunity for the physical activity for the children. So we know that stunting, based on the data, shows that stunting has declined steadily from 2000, okay, but somehow for the wasting it still persistent, and then for the overweight is required for reversal in track trajectory in order to achieve 2030 target for the SDGs. Now, where are the children? So most of the children with the malnutrition issue actually located in Asia region. So we have about 50% for the stunting, okay, 70% for wasting, and for the overweight actually it's about 48%. So stunting, right? If we compare the year 2020 and 2020, somehow it's reducing. It's reducing. So we look at the data for the ASEAN specifically. It's already reduced. Reduced is at certain amount. But for the wasting, okay, for the ASEAN country, it still remain as the one of the issues with the 25 million. And then when we look at overweight, okay, what it tells us, actually somehow from the 2000 to 2020, actually is increasing in terms of the prevalence. When we look at the Asia by itself, actually is increasing from the 60.5 million to 80.47 million. So the world, so the world is not on course to meet targets for stunting, wasting, and overweight, right? So if you look at this, it's still like if we look at the projected based on the current prevalence, it's still far away from target for stunting for the stunting, overweight, and wasting. So although malnutrition can be manifest in multiple ways, but then for the prevention is virtually identical for the adequate maternal nutrition before and during pregnancy, and while breastfeeding, for optimal breastfeeding in the first 2 years of life, nutritious, diverse, and safe food in early childhood, and a healthy environment including basic health, water, hygiene, and sanitation services, and opportunity for safe physical activity. So what are the health implications? Okay, so the health implication is good to look at the triple burden of malnutrition, how actually is harm the children, adolescent, and the women. Because when we're talking about the malnutrition among children, is need to start from the pregnancy. That's why we usually focus on the 1,000 days. So under nutrition, we have like stunting and wasting, hidden hunger, deficiencies in micronutrient, and overweight, including obesity here. So there are many, there are long list of the implications. So what are the effects? For example here, it touches about the infection and death for the stunting, poor growth and development for specific deficiency of micronutrient. And then for the overweight, including obesity, we have like long-term obesity, diabetes, and other metabolic disorder. Usually in my clinic, currently the number of obese children is increasing, that referred to me. And also in terms of the disease, some of patients is already borderline or actually already have the diabetic type 2, not type 1, it's type 2. For the mother, under nutrition, stunting, and underweight, of course, they have many complications in terms of prenatal. And then look at the certain calories, certain micronutrients, it will go to the some sort of complications, prematurely low birth weight, and impact cognitive development in newborn. And then we have about the overweight mother that include obesity, high risk for the GDM, gestational diabetes, and preeclampsia. And then of course overweight and chronic diseases for child in later life. So it linked to the fetal as well. So this the the malnutrition harms in children, adults and women can link to this is somehow the outcomes of these malnutrition issues. So improvement nutritional status of malnourished children. Okay, we know that wasting adversely affect the linear growth of children, indicating that the early identifications and treatment of wasting may play a role in stunting prevention efforts. Okay, so therefore, a global child malnutrition demands a new response, on that can deliver nutrition-specific interventions and nutrition-sensitive development in more coordinated fashions, more improvement in terms of coordinations. The response must be acknowledged the central role and responsibility of the food system and work together with the health, water and sanitation, education and social protection system to provide better diet for children. So it's not just promoting breastfeeding, it should be better supporting for the poorest family, labeling clearer and more informative to tackling iron deficiency anemia and other form of hidden care hunger, improving children food environments, making safe drinking water available everywhere to improve children nutrition. So this is one of the framework from the UNICEF in 2020-2030 Global Strategy for Maternal and Child Nutrition. So from this graphic, we look at that, we know that in order to improve children mother diet, sufficient resources should be there. Environmental, financial, social, and human resources to fulfill children's and women's right to nutrition. So this should be comes together from the another factors, another is good governance and also positive norms from the society. So good governance is cover all the political, financial, multi-sectoral commitment to advance children and women right to nutrition. And meanwhile, for positive norms, social and cultural commitments to advance children and women's right to nutrition. So this one actually can lead to the adequate food, adequate feeding and health improvement. Health environment. So with the better breast milk, nutrient-rich, age-appropriate food, with safe drinking water, for example here, can provide good diets not just for the children, but also for the women, and therefore it will to the improvement in terms of nutrition for the children and women, improve survival, health, physical growth, cognitive development, school readiness, and so on. So just to look at how what's the current situation, what the so important about breastfeeding. So breastfeeding will give benefit to the child and also to the mother. For example, for the children, for the child, lowers denoted in infant mortality, protects against diarrhea and respiratory infections, protects against middle ear infection and so on. And meanwhile, for the benefit for the mother, is help for the prevention of postpartum hemorrhage and improve birth spacing. And we noted that many regions have made gains in exclusive breastfeeding. Okay, most of the region globally also globally increase or improve in terms of exclusive breastfeeding. Okay, now I just to share with you multiple responsive multifaceted and challenge, a system approach to nutrition. Okay, so a system approach to nutrition reflects the reality that child nutrition has multiple determinants, and therefore we need to share the responsibility not just from the sectors and stakeholders, but of course from the public and private. Okay, and then therefore we need to put children needs must be at the heart of food system, and then nutrition-specific approaches are also needed in 4 key supporting systems as mentioned before: health, water and sanitation, education, and social protection. So this is just the graphic to show all the systems come together. Okay, the food system, activities and actors involved in bridging food from production to the consumption and through to the disposal. And then for the health system, it's not just includes the preventive services, but we have to strengthen the corrective care as well. And then we have the water and sanitation system, okay, comprises the policies and program services, facilities and actors involved in providing safe drinking water and safe sanitation infrastructure in order to ensuring safe food, safe drinking water and clean and healthy environment for children, adolescents and women. And the fourth one, we have the education system, okay. We need to have to design and educate program children from the basic kindergarten to secondary school. Okay, a strong education system has trained teachers, sound pedagogy, solid infrastructure and resources in order to delivery system to improve nutrition outcomes. And of course, cannot put aside the social protection system. So this is how actually we show how the food for the diet of child and also adolescents come from that link to the behavior of caregivers, children, and adolescents. All right, household dynamics, acceptability, and desirability of food preparation and eating patterns also. This is somehow influence the diet of children and adolescents, and then it's linked together to all the phase of the food from the external food environments, food supply, and then to the individual. Okay. Now, just previous slide is more on the what actually the overview about the prevalence of malnourished children. What are the WHO and UNICEF framework to tackle malnourished children? So now, in order to look at the quality to the nutrition services, I will share with you what are the National Plan of Action of Nutrition Malaysia NPNM 3 2016-2025, and somehow we try to emphasize on the primary and tertiary care. So as I mentioned before, okay, these are some of the reference that we use by the Ministry of Health in order to formulate the NPNM 3 that target for this this year. So these are some of the law policies and guidelines that we cover most of the most important key component inside the in the framework just now. Okay, we have like, for example, for the NCD, for breastfeeding, NCD, we have like agriculture for the national agro policy. All altogether was taken into the consideration in a way to prepare the NPNM 3. So just to before proceed the new one, okay, previous NPNM already cover some of the important guideline or policy that cover pregnant women until the elderly, nutrition throughout the life cycle. So nutrition program are divided into planning, surveillance, rehabilitation, also promotion. And then it's mainly to address both under and over nutrition among the population throughout the life cycle. So for today, I will not cover all because it's too many, right? So I just cover for the pregnant woman, infant, and young children, also children this 6 years and below. So nutrition program activities related to pregnant women and infant, okay, it's important to have optimal physical and mental development and long-term health of the population. So nutritional issue related to this group include macro and micronutrient deficiency, as we noted in many literature say that it's regarding the anemia, iodine deficiency, and also poor maternal gain. So the concept of first 1,000 days is also integrated into all the activities related to maternal nutrition to promotion and improve nutrition for mothers and children. So the element of first 1,000 days is so important because it's profound impact on a child ability to grow, learn, and rise out of poverty. So this is some of the list of the nutrition programs and activity related to pregnant women and infant that we has already conducted and in the previous NPNM. So we have several activities that in the community-based program, are also the primary care and also the tertiary. So, for example here, okay, for the nutrition counseling for pregnant and lactating women is already provided by the nutritionists and in the health clinics, and also by the dietitians for those in the hospitals. And then we really strengthen on the baby-friendly hospital initiative. If for your, most of the hospital in Malaysia, especially under Ministry of Health, already have this certificate to empower, to enforce the baby-friendly hospital initiative. And then we really straight on the code of ethics for the marketing of infant food and related products. Okay, and then some of the cooking demonstration and diet for mothers and infants is already conducted. However, during the pandemic, some of the program already continuously planned in the using the technologies perform virtually. Okay, so nutrition program activity for 16 years old and below. Okay, for example, nutrition surveillance. We have rehabilitation program for malnourished children, and also we have nutrition activities at children care centers. What we call in Bahasa we call TASCA. So for the nutrition surveillance, how we link to our conference thema today. So in Malaysia, actually, there is a group of researchers previously is year back 2005 that look at the risk of malnutrition, prevalence of malnutrition, using the remote sensing and geo information system (GIS) somewhere in north of Kalimantan in Malaysia, the location. So based on this system, they can have a very strong data in terms of distribution of the malnourished children. Okay, so based on this distribution, they know that which area actually currently actually higher prevalence of malnourished children, whether it's obesity, stunting, wasting. So this is connecting all the clinics so that we can provide a better treatment for the children. Nutrition surveillance also, we have one of the state in Malaysia, we have apps that use to tracking or track the malnourished children. So this what you call ASAS, the Anak Selangor Anak Sihat initiative to measure and improve the nutrition status among malnourished children in the Selangor B40 community. In Malaysia, we already categorize our population into T20, M40, and also B40, right? Depending on the level of income, socio-demographic, socio-economic status. So here, this is one of the apps that actually to track the potential high-risk children to get the malnourished, whether it's obesity, underweight, or stunting. So here, tracking system, right? And then based on the system, the government will know that the numbers of all the prevalence of obesity, wasting, also stunting. So nutrition programs and activity for children with special needs also was conducted in the community base, and also of course in the hospital for the tertiary care. Nutrition program and activity for school children. So we have previously and now also in the new and elementary, we have a preschooler program and also for the secondary until the secondary. So usually during COVID-19, most of the program that need to be conducted is run in the online platform with the many kind of activity, but in the online platform. So okay. Okay, sorry. Okay, so for the NP and N3, there's some of important element put inside in this national plan for the nutrition. So I would like to focus on these three, number 3, 4, and 5. So for number 3, okay, incorporating the, sorry, I cannot see. So for this number 3, okay, promoting sustained food system. So they have several improvement in terms of public-private partnership, collaboration with food and beverages industry to produce healthier food and beverages product. Why I'm highlighted these words actually the healthier food choices. Actually, in Malaysia we already implemented. For example, for the beverages, it's already in the can. For example, we already have the a label for the healthy choices. So something like something like coffee also, is it a good choices or not? And then it's a good choices. Is rely on the sugar content inside the products. Implementation of weight reduction program for school children. So we start to have a program at the school level whereby it include all the teachers, also the health clinic next to the school, and they're creating a healthiest ecosystem which will contribute towards healthy lifestyle and disease prevention. And then incorporate nutrition to sustain food system through collaboration with all the relevant ministries and non-government agency. So we come across a program like mini program here. And then one of the program actually specifically for the children, Striking Kebun Dapur project initiated by the preschooler, what you call Kemas, to inculcate fruits and vegetable consumption among young children. And then for the number 4, inclusion maternal nutrition to enable strategy of promoting infant and young child nutrition. So here we have try to strengthening the maternal nutrition strategies for the anemia, IDD, appropriate weight gain among pregnancy mothers, greater emphasis on nutrition during the first 1,000 days of life, breastfeeding and complementary feeding. And also we try to strengthen the code of ethics for the marketing of infant food and related products. So for number 5, strengthen the facility strategies in providing standard nutrition guidelines for various age group. So for this one, we try to strengthen and review some of the guidelines. For example, RNI and Malaysian Dietary Guideline. Now we have specific Malaysian Dietary Guideline for the children, for the maternal, for the vegetarians, and to target this issue. Okay, and then we strengthen the nutrition research and development. Okay, so this is a framework for NP and M3. Okay, starting from the foundation of the objective consideration component into national development policies and action plans. So we have the facility strategies. What are the strategies in order to enabling the strategies, okay, in order to achieve the objective and the goals, which is towards achieving optimal nutritional well-being and well-being of leisure. So for the NPA and 3, okay, how we implemented, actually there are many ways for the MOH at national level, at state level, and district of course, and then we come with the nutrition technical working group to revise, to look at back the established policies that we have, and then to review it back. And then of course international body, WHO, United Nations Agency, regional officers, and ASEAN countries. So for the interministry agency, okay, we already collaborate with the Ministry of Health, collaborate with the university, professional bodies, NGOs to implement the NPNM 3 as before. So I just share with you one of my project to tackle malnutrition among children, especially stunting issue in Malaysia, because the issue in stunting issue in Malaysia is increasing. So we look at the way how we run the program to empower our community with the information. We try to tally the program. For example, we have the website that we share throughout the Facebook. Link this to our special website that contain all the information that provided with the specialists, and then we tag together with the Facebook to make sure that public aware of that. And then we have another what it calls drama, doku drama, to link this drama with all the informations. So all the information we try to deliver to the community throughout the drama, so that they can get the message, not really in intensive situation, but just relax, look at the drama, and then they get some of important points that's so important point that to combat the issue on malnutrition among children, especially during the 1,000 days. So just before and towards the end of my presentation, I just to share with you what are the primary healthcare recommendation. Okay, so some of this recommendation to tackle the malnutrition among children. So here, just to share with you that we have nutritional counseling of parents and caregiver in the health clinics, and then of course we need to monitor the most of the changes, track the changes of the nutritional status of the children. Okay, so for the assessing and managing children at primary healthcare, okay, to prevent overweight and obesity in the context of double burden of nutrition, need to actually anthropometric assessment and classification of nutritional status, manage of infant and children with acute and chronic malnutrition presenting to primary healthcare facilities. So if let's say they have running a program, they will detected there is a group of children with the risk of malnutrition issue, will send them to the care to the healthcare facilities, such as clinics, and from the clinic, if they say health clinic, the issue is come together with some sort of some kind of diseases, and then we will bring them to the tertiary care, which is hospital. So management of children who are overweight or obese present also same to goes to the obese and overweight children. So during the pandemic, right, we still need to conduct the counseling for the children. Some of the health clinic and also the hospital, they start use telehealth consultation, and then how to actually to increase the compliance, everything. We try to share sharing videos that related to that particular session consultation. Okay. Okay, and then for just to share with you, 10-step program for inpatient treatment. Okay, so just to briefly from the 10-step, just try to 3. So initial treatments for the hypoglycemia, hyponatremia, dehydration, infection. So usually when the children with the health malnutrition issue, when it comes to the tertiary treatment, the hospital, we have the initial treatment, rehabilitation, some the electrolyte or nutrient imbalance, and then feeding is increased to stimulate catch-up growth, and children are prepared for discharge. And then follow up, usually when the malnourished children discharged from the hospital, we need to have follow up. Usually in our practice, we have monthly basis or 3 monthly basis. Okay, so this is just to share with you some of the treatment during the admissions. Okay, so I think I already cover most of the from the global until the very specific to the tertiary management, and then just summary and key importance points for all of you. Okay, so I just summarize back. Okay, we know that starting issues is still decline, but we need more faster progress to actually achieve the target of SDG 2030. And then then for the wasting, and also we need to have some sort intervention to improve the prevalence. Okay, so as mentioned before, the world is now on course to meet target for stunting, wasting, and overweight, and we're still far away from the target. And then of course, in order to tackle this issue, the big approach, a system approach to nutrition, it should consist of food system, health system, water and sanitation, as well as education system to be embedded in the national nutrition strategies. And then, of course, we need to strengthen also the primary and tertiary care, the more focus on treatment and monitoring malnourished children in order to catch up their nutrition status and growth. So with that, I end my presentations today. It's quite very too many things inside I try to put. But somehow, if let's say you have any issues or any questions, you can link to this email. and of course we have the Q&A session. So with that, I end my session. I end my presentation today. Thank you.
Thank you very much, Ms. Nur, Dr. Ms. Dr. Nur Zura, right? Okay, I'm sorry.
Just call me Zura. It's very difficult. Just call me Zura.
Okay, Baizura, Dr. Baizura, right. Thank you very much for the presentation. The presentation is about the improvement of quality nutrition services to increase the growth and development of malnourished children. Okay, right. So if I may make some point in your presentation, let me just make some point here. That is about the number one. That is about the malnutrition. It can harm children. Okay, the malnutrition, it can harm children, and then when the level of malnutrition in children increase, and it can cause, number one, that is stunting, and then wasting and overweight. All right, then number two, to improve this malnutrition, we are suggested to have good diet, good care, adequate food, and then adequate feeding, healthy environments, good environments, and also to improve the quality of nutrition services, we have the nutrition program that is about the nutrition planning, nutrition surveillance, nutrition rehabilitation, and nutrition promotion. Okay, it comes to the question and answer session, and then we please the audience to ask question if you have any question about this theme. Yeah, okay, please, audience. It seems that someone asking a question, please. Okay, before you ask a question, please identify yourself and then state your name and also your institution. Okay, time is yours. Christina.
Hello? Is my voice clear? Mr. Holik, is my voice clear?
Okay, yep.
Okay, thank you for Mr. Holik. Thank you for your presentation, Ms. Nur from Malay. I want to ask, or first I want confirmation about your slide that you have shown. The nutrition program and activities related to pregnant women and infant. You said that there were 12 programs. Are all of the programs have a place in your country, or still have trouble in your country?
Okay, share back the slide. I believe, okay, I believe this one, right? Is it correct? Okay, you asking about this 12 program, whether it's in place, and then whether is there any issues related this program? Oh,
Yes, ma'am.
okay. So I just brief back about this one. So basically we have for the pregnant woman and infant that related to this program specifically designed to the pregnant woman and infant. So we have about 12 program or 12 approach to tackle this issue. So for example, of course, some of this is actually from the previous nutrition plan for the Malaysia, the second plan, and also now actually in the third plan. It means that the problem, of course, some of the problem is still there. Okay, that's why we have a need to continually run the program. And then, for example, let's say baby friendly hospital initiative. Okay, for the hospital under Ministry of Health, right? Most, I think I can say that 100% get the certificate. But for certain private hospital, we still have very minimal number. For the teaching hospital, at this point of time, only my Ministry Hospital Mesti Putra Malaysia, because of we still a new hospital and then in the process to get the certificate. And then for the baby friendly clinic initiative, clinic rakan bayi, this one actually is still running. Okay, of course it's continuous. Because it's service whereby once the mother come to the clinic, we will give consultations. We give how to do everything related to the infant breastfeeding, for example. Okay, and then we have like of course anemia deficiency is still there. Okay, it just is more to increase the awareness, to increase the effectiveness of the program. Is it helpful, the answer?
Okay, thank you. Because I'm a midwife, I wanna short the program in number 4, breastfeeding promotion. In my country, especially now on that, every regency must be push the breastfeeding promotion level. So initiation for breastfeeding in the first time after the delivery the baby is increasing for now on. How about your country? How about the Malay in your country? Is there still standard level to cover breastfeeding promotion or to evaluate the program? Like
Okay.
us?
Yeah. So breastfeeding promotion actually is continuously continuously running in the country. And then breastfeeding promotion actually is linked together with the baby friendly hospital initiative actually. So we talk about the first time baby feed actually, because in Malaysia usually in the hospital. So one of the requirement to get the certificate, we need to achieve 100%. I think 100% or 80% from 100% from the patient actually when they get delivered the baby they have to try and they have to feed the baby in the labor room. Okay, so this actually will be audited during at the time we try to get the certificate. Okay, so this is forever, I believe. It keep continuing for the next phase of the plan and nutrition plan. And then because of that, I believe this is increased the prevalence of exclusive breastfeeding in most of the region.
So the program still counting, right? Same in my same as in my country.
Yes.
But the in your country is an standard value or target like that. Something like we have a target 78% for the breastfeeding promotion with the initiation breastfeed in the first delivery baby.
Okay. I'm very sorry. I'm not so sure in terms of percentage inside. When as I remember, as long as the baby delivered in the hospital, the midwife start to promote breastfeeding. Need to make sure that the mother start feed the baby. Okay, but if let's say certain case also we need to make sure that the mother follow the specific guidelines. So in here, I believe we take note that it's so important to start the breastfeeding at the point of labor time, at the point of delivery.
Okay, thank you, ma'am.
Thank you very much, Miss Christine. What do you think? Do you think that the answer answer your question? All right. Okay. For the next coming, maybe audience who wants to ask, please. We have one more question to ask. Okay, I'll give you the opportunity for asking this question.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you, Pak Holik, for the opportunity. Dr. Bazura, thank you for your nice presentation about a nutrition program in Malaysia. I just wondering, would you mind to sharing with us about the role of nutritionists and dietitian in Malaysia in giving nutrition service to public? Could you mind sharing with us? Thank you.
Okay, thank you so much. Okay. Yeah, I noted we in Malaysia we have a nutritionist and also we have dietitians. Actually, my background is dietetics. That's why I'm actually a dietitian, and now actually I'm give my not just teaching the student under University Putra Malaysia, but I'm also actually handling clinic for the type 2 diabetes for the children. So in Malaysia we have huge number of obese children, and then some of them actually already at risk of type 2 diabetes, and some of them already actually in the treatment. Okay, so of course I need to meet them almost all the time. So when come back to the question, nutritionists and dietitians, okay, in Malaysia, for your information, we already are working towards on the Allied Health Act. We start to register whether you are dietitians or you are nutritionists. We try to have different professional services. So for the dietitian, if let's say we're talking about in general, okay, for the dietitians, we have mainly we focus on the hospital, okay, but in the area of the dietetics, actually we have clinical, we have food service, and then we have also dietetic in the community. It's just different in terms of approach, how actually we are running the program. Okay, for example, for myself, when talking about why I try to have a program that related to the stunting issue, for example, I will go in terms of how actually I implement medical nutrition therapy in order to treat them. You're talking about the child obesity, I will plan in such a way how to target her for the, have a specific target for the children. When talking about nutritionists, it's more on it's more on the health clinics, and then it's more on community works, and that more working towards preventive aspect, as compared to the nutrition is more on the treatment aspect. So I give you a scenario. Let's say in the community, the nutritionists, they run a program, a school-based program, let's say, okay. And then from the school-based program, we noted that this group of children is very obese, for example, and then they will ask them to, to looking forward the help, the treatment from the health clinics. So let's say in the health clinic is still dietitians and nutritionists in the clinic. We still have dietitians and nutritionists. The difference is if let's say the child only having issue in terms of obesity, then the nutritionist can looking forward on this child. But if they say this child actually at risk of already, some of the biochemical data is haywire, okay, and also the physician plan to start the medications or already, already give the medications. So this actually come back to the dietitians. So that's why I usually patient, those with malnourished usually come to see me because of the malnourished, plus with several complications, let's say feeding issues with the rice tube, for example, for the obese with the type 2 diabetes, for example, that need more, more individualized management. I hope it's clear.
Is it clear?
Is it clear?
Yes. Okay, then. Yes, is it clear? Or you have more comment? Right. When there is no more.
Thank you, Dr. Bezura. It's very clear. Looks like similar in our country too about the role of nutrition and dietitian.
Yes.
Okay, thank you very much. It's very interesting to talk about the malnutrition. Moreover, it's about the stunting and wasting, and also overweight. So it's so interesting. Right. I think it's come to the end of our seminar, and then I would say thank you very much, Miss Dr. Bezura. Okay, I thank for your participation in this international conference. We would like to give you virtual certificate. I think this is the virtual certificate. Okay, right. Thank you very much for joining our seminar, Miss Dr. Bezura. We hope that we can meet again in our next coming opportunities to have another international conference. Thank you very much.
Thank you very much.
Okay, then it's time for me to give this floor to the MC, and thank you very much for your participation. And I think that's all for me. Then I would say Assalamualaikum warahmatullahi wabarakatuh.
Poltekkes Kemenkes Kaltim terletak di kota Samarinda. Samarinda merupakan ibu kota Provinsi Kalimantan Timur dan kota terbesar di Pulau Kalimantan. Seluas 718 km persegi dengan jumlah penduduk kurang lebih 1 juta jiwa. Politeknik Kesehatan Kementerian Kesehatan Kalimantan Timur sebagai satuan kerja Badan Layanan Umum mempunyai tugas pokok yakni menghasilkan tenaga kesehatan yang siap kerja, profesional, dan berkompeten.
Saat ini Poltekkes Kalimantan Timur berada di 3 lokasi. Lokasi pertama kami beri nama Kampus A berada di Jalan Kurnia Makmur. Tempat saya berada sekarang di gedung direktorat, kemudian perkantoran, kemudian ada gedung jurusan gizi dan dietetika dan gedung jurusan promosi kesehatan, lalu ada gedung jurusan teknik laboratorium medik. Kemudian kampus B berada di Jalan Walter Mongisi di Samarinda. Di sana ditempati oleh 2 jurusan, ada jurusan keperawatan dan jurusan kebidanan. Dan satu lagi kampus C kami di Jalan MT Haryono Balikpapan, ditempati oleh Prodi D3 Kebidanan Balikpapan.
Poltekkes Kemenkes Kaltim telah terakreditasi B oleh Ban PT dengan nomor 61/SK/Ban PT /Akred/PT/4/2018. Saat ini Poltekkes Kemenkes Kaltim memiliki 5 jurusan, yaitu keperawatan, kebidanan, teknologi laboratorium medis, gizi dan dietika, serta promosi kesehatan dengan 12 program studi jenjang Diploma 3, Diploma 3 Keperawatan, Diploma 3 Kebidanan Samarinda, Diploma 3 Kebidanan Balikpapan, dan Diploma 3 Teknologi Laboratorium Medis, jenjang Sarjana Terapan, Sarjana Terapan Keperawatan, Sarjana Terapan Kebidanan, Sarjana Terapan Gizi dan Dietika, serta Sarjana Terapan Promosi Kesehatan. Jenjang profesi, pendidikan profesi nurse, dan pendidikan profesi bidan. Poltekkes Kaltim juga merupakan satu-satunya institusi pendidikan kesehatan di Kaltim dan Kaltara yang memiliki prodi pendidikan jarak jauh, yaitu prodi PJJ Diploma 3 Keperawatan dan prodi PJJ Diploma 3 Kebidanan. Penambahan prodi lain terus diupayakan. Tridharma Perguruan Tinggi dilaksanakan dengan komitmen tinggi dan berinovasi, mengikuti perkembangan teknologi seperti penggunaan sistem informasi akademik atau SIAKAT. Pembelajaran dilakukan secara luring dan daring dengan kurikulum yang selalu dikembangkan. Jumlah penelitian setiap tahun mengalami peningkatan yang memuaskan. Pengabdian masyarakat yang dilakukan berdampak langsung ke masyarakat manfaatnya. Poltekkes Kemenkes Kaltim mendidik mahasiswa untuk memiliki karakter tangguh, peduli, jujur, dan cerdas atau tali judas. Mahasiswa dipersiapkan kompetensi dan kemampuan soft skill, fleksibilitas, BEM, HMJ, HMP sebagai organisasi kemahasiswaan untuk berkreasi. Unit kegiatan mahasiswa atau UKM mendapat perhatian dan fasilitas. Kerjasama yang terjalin dengan pihak lain terus ditingkatkan seperti study exchange. Layanan terhadap alumni didukung dengan sistem informasi legasi dokumen akademik atau SIDOKA dalam rangka menunjang kegiatan pembelajaran politik dan mengasah kemampuan skill mahasiswa. Poltekkes Kemenkes Kaltim didukung dengan laboratorium terpadu. Beberapa laboratorium unggulan seperti mini hospital, ruang operasi, lab kimia, lab mikrobiologi, lab kuliner, Lab OSCE, Lab ANC, hingga lab komputer. Peralatan praktek sesuai dengan standar laboratorium dan diupayakan alat terbaru yang digunakan di fasilitas kesehatan sehingga lulusan telah mengenal alat dan siap kerja. Perpustakaan terpadu Poltekkes Kemenkes Kaltim dapat dikunjungi langsung maupun secara daring. Judul buku yang dimiliki lebih dari 1.000 judul. Beberapa layanan dapat diakses melalui website poltekkes-kaltim.ac.id seperti repositori online, jurnal online, dan peminjaman buku online. Poltekkes Jaya, BLU Poltekkes Kemenkes Kaltim, keren, kreatif, efektif, responsif, efisien, never give up.
Poltekkes Jaya, mahasiswa belajar.
Thank you for the moderator and the last speaker. And before we closing the ceremony, I would like to read some announcement for the participant now. First, don't forget to fill out attendance and evaluation form using link that have been shared by the committee via chat Zoom. Second, please make sure your name and the title properly due to the benefit of the certificate, and the certificate will be distributed at least 1 month after the conference using link Google Drive that will be shared in the WhatsApp participant group. And now we're going to invite all participants who joining Zoom to see 10 poster. Please, the committee.
Show the poster.
First poster with the title The Effectiveness of Soybean on Hot Flash Symptom Reduction in Premenopause Women at the Panglima Sebaya Tanah Pasir Hospital 2022.
The second poster, the title is The Effect of Module Use on the Motivation and Decision of Pregnant Mothers to Give Birth at the Health Facility.
The next poster with the title The Effect of Warm Water Compression to Treat Back Pain in Trimester 3 Pregnant Woman in Fertilizer Hospital Kaltim, Bontang.
Next poster with the title is The Effect of Combination Between Oxytocin Message and Breast Care on the Breast Milk Time on Spontaneous Postpartum Mothers at A. Wahab Shahrani Hospital.
Okay, the next poster is with the title The Influence of the Audiovisual Application of KB MKJP on the Knowledge and Decision Making of KB MKJP at UPT Puskesmas Tering, Seberang Kutai Barat.
Okay, next poster about the effectiveness of health education using audiovisual and leaflets on The motivation to carry out IVA examination at Pasir Blengkong office employees.
The next poster with the title The Effect of Giving Lemon Aromatherapy on Nausea and Vomiting on Pregnant Woman in Semester 2 and Simoy 2 Village.
Okay, next poster about effectiveness of early breastfeeding initiation or EIMD on change in body temperature of newborn babies at Amalia Bontang Hospital.
And next poster is breastfeeding mother self-efficacy relationship with exclusive breastfeeding at Posyandu in the work area of Public Health Center Muser Hospitality in 2022.
Okay, the last poster is the effect of COVID-19 vaccine counseling on the interest of the COVID-19 vaccine in pregnant mothers trimester 2 and 3 in UPTD Samboja Health Center.
Thank you for the participant who joined with us on poster presentation.
Okay, finally we come to the end of the agenda today. I hope you have found many information and education and knowledge from this conference.
Last but not least, in this opportunity, I would like to thank for the last time for the representative from Ministry of Health of Republic Indonesia,
Director of Health Polytechnic of East Kalimantan, along with all staff,
our great speaker and moderator,
our sponsorship from Bank Tabungan Negara, and to all participants and committee parties in this conference. As your master of ceremony today, from my deepest heart, I apologize from my mistake and flaws in guiding this conference.
Billahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Oke, baik. Aku ini ngasih apa nih? Direkam.
Asik.
Itu ada nggak anunya, teksnya?
In English. Aku ngerjain kok.
Oke, Assalamualaikum warahmatullahi wabarakatuh. Saya mewakili teman-teman panitia di Second East Borneo Health International Conference Politeknik Kesehatan Kementerian Kesehatan Kalimantan Timur mengucapkan terima kasih yang sebesar-besarnya kepada seluruh pihak dari mulai pimpinan sampai dengan staf di lingkungan Politeknik Kesehatan Kementerian Kesehatan Kalimantan Timur yang telah mendukung terlaksananya acara kita bersama ini. Mudah-mudahan itu dicatat sebagai amal ibadah untuk bekal kita kelak. Dalam kesempatan ini juga saya selaku pribadi ingin mengucapkan terima kasih yang sebesar-besarnya kepada tim saya yang luar biasa hebat, yang sudah membantu saya tanpa lelah, tanpa kenal waktu, sehingga acara ini bisa terselenggara. Harapan saya ke depan ikatan yang sudah terbina ini bisa kita pertahankan sehingga untuk agenda-agenda besar kita di depan bisa kita laksanakan dengan kompak, dengan lebih baik lagi. Itu kira-kira close statement dari saya. Sekali lagi terima kasih kepada semua pihak yang sudah terlibat terhadap terlaksananya International Conference ini. Saya akhiri. Assalamualaikum warahmatullahi wabarakatuh.